Just give me a second. We are going live on YouTube. Just give me a second so that I can. Okay. So before we begin with this session, I would be giving just a few instructions. This is a community awareness session and it is also running live on YouTube simultaneously. All questions will be taken up at the end of the session. Please raise your hand at the end of the session and not now. And I will invite you to ask your questions sequentially. We have requested our speaker to conduct this session in English, that is Hindi and English combined, for a better understanding of the people who are joining. Since we have got students, parents, teachers who are going to be joining this session, I really hope everybody takes something good from this session back home. Since some people are not comfortable about sharing their mental health issues in public forum, though we feel that there is nothing to be ashamed about, there is nothing to be uncomfortable about, because mental health issues definitely need to be spoken about in open. But still, if it makes you uncomfortable, you can send message to me personally in chat box and I will take it up for you without revealing your name. The next session is on managing mood changes in children and teenagers on 30th of October 2022, which will be live on Zoom and YouTube channel. The YouTube channel name being Teen Talk for Better Tomorrow. You can search it, and if you have not yet liked and subscribed the channel, please do like and subscribe to the channel, and you will be able to see all the 30 videos which were done on adolescent health and parenting till date. And of course, please keep yourselves muted at all the times. And only when you are invited to ask a question, please unmute yourself and immediately later mute yourself. Now with this, let us begin with today's session. So childhood and adolescence are critical stages of life for mental health. This is the time when rapid growth and development takes place in the brain. Children and adolescents during this phase acquire cognitive, social, and emotional skills that shape their future mental health and are important for assuming adult roles in the society. Many social, environmental, economical, cultural factors where children and adolescents grow up, it shapes their well-being and development. Early negative experiences and influences at home, in school, or in digital spaces. We are living in digital world these days, such as exposure to violence, the mental illness of a parent or other caregiver, bullying, poverty, etc., increase the risk of mental illness. So what is mental health? Mental health in childhood means that you reach a certain development and emotional milestone and you learn healthy social skill and how to cope when there are problems as a child and as an adolescent. Mentally healthy children have a positive quality of life and they can function well at home, in school, and in their communities. Similarly, mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions, which can distress and the problems getting through the day. I mean, they cannot just get through the day by themselves without getting stressed for the entire situation. It can be difficult to understand mental health disorders in children because normal childhood development is a process that involves change by itself. So additionally, the symptoms of a disorder may differ depending on a child's age. They have different problems in a younger age group. As they grow into their teenage, the problems are different, and they go into their tweens, that is the 20s, the problems may be very different. And the children of smaller age, or even the adolescents or the teenagers, they are not able to explain how they feel or the way they are behaving in a certain way. But if we see the statistics, they are really alarming. As per a paper in 2019, at any given point of time, nearly 50 million Indian children suffer from mental disorders, and I'm sure these numbers may have shot up during the COVID times. It is also estimated that about 9.8 million of Indian children aged 13 to 17 years suffer from serious mental illness. Another report published by the WHO showed that the prevalence of suicide is 21 per 1 lakh population, and our population, mind you, is in billions. So there is nearly 2,58,000 Indians committed suicide in 2012 according to a study. So this is between the students aged 0 to 19 years, mind you. We are not taking into consideration the adults. It is also estimated that every 90 minutes, a teenager tries to commit suicide in India. Many of these attempts are half-hearted cries for attention, help, and love. But every 6 hours, one of these people who is trying to commit suicide, they succeed. Therefore, the impact of mental illness is far beyond the imagination of the society, and because of which, for us to create awareness about the same is very, very, very important. So on the occasion of Mental Health Awareness Week, this is the Mental Health Awareness Week from 3rd to 10th October, which is going on. And 10th October is celebrated as Mental Health Awareness Day. We bring to you this very important session on Mind Matters Most, where we discuss mental health issues in children and teenagers. For this, we are really happy to have a very renowned and acclaimed speaker who calls himself Friendly Neighborhood Psychiatrist, Dr. Karsi Bomi Chawda. And it is a great pleasure for me to introduce sir to our viewers and our participants today. Please allow me to share my screen. Yes. So sir is a consultant at PD Hinduja Hospital and Sir H.N. Reliance Foundation Hospital with a work experience of nearly 35 years in the field of psychiatry. He is past president of the Bombay Psychiatry Society. He is past chairperson of the task force of the Indian Psychiatric Society, that is IPS, dealing with school psychiatry and counseling of ethical boundaries between client and doctor. He is past panel member of the IPS task force that laid down clinical guidelines for the treatment of autism spectrum disorders and learning disabilities in Mumbai. He is currently advisor of the IPS task force dealing with LGBTQ community. The field of interest is issues related to children. Sir has got multiple awards and oration to his name. And with this, sir, it is my great pleasure to have you on this show. A very, very warm welcome to you. And, the stage is all yours. Please take over the session.
Thank you. Thank you so much, Dr. Archana. It's always a pleasure to be here. Now I'm going to attempt to share my screen.
Yes, sir, and I'm there to guide you.
So I click on share screen.
Right, sir.
And I click on power.
Sir, you'll have to click on share screen again. It's not yet started. Once you click, I should be able to see. Yes, now I'm seeing. Now just go to the bottom of the panel. You will see a red colored icon with P written. Yes, I'm seeing.
You're seeing?
Yes, yes, sir.
Okay. So ladies and gentlemen, boys and girls, as they say in Indigo Airlines, it's a great pleasure to be here. And I'm going to be talking a little bit about what happens in children and adolescents in terms of their mental health. बहुत बार मुझसे पूछा जाता है कि आप लोग जो डॉक्टर लोग हैं, बच्चों के क्या मेंटल हेल्थ प्रॉब्लम्स हो सकती है, ऐसा क्या चीज है जो बच्चे लोगों को इतनी तकलीफ देती है कि वो हम उनको आपके पास लाए। कभी कभी पूछते हैं कि ये जो आप मेडिसिन देते हैं बच्चे लोगों को, क्या इसकी जरूरत है? क्या इसकी वजह से कोई साइड इफेक्ट नहीं हो सकता है? क्या इसकी वजह से बच्चा जो है उसमें कोई कॉम्प्लिकेशन नहीं आ सकता है? क्या उसकी लिवर, उसकी किडनी, उसके हार्ट पे असर हो सकता है? एंड दिस इज ऑल एब्सोल्यूट नॉनसेंस। Fact, like Dr. Archana said, mental health disorders in children are generally defined as delays or disruptions in developing age-appropriate thinking, behavior, social skills, or regulation of emotion. तो अगर हमने उनको देखा, बच्चे को देखा, जिस प्रकार से उनका व्यवहार है, जिस प्रकार से उसका बिहेवियर है, जिस प्रकार से वो उसकी एकेडमिक्स है, we look at it in terms of क्या वो एज अप्रोप्रिएट है क्या? अभी मान लो कि 2 साल के बच्चे को स्वीट चाहिए थी और हमने मना किया, उसने टेम्पर टैंट्रम कर लिया, सो यू फाइंड दैट वेरी स्वीट, यू फाइंड इट एज अप्रोप्रिएट। अगर 10 साल के बच्चे को स्वीट चाहिए और आपने मना किया और उसने टेम्पर टैंट्रम किया, तो वील से दैट समथिंग वेरी रॉन्ग। अगर 17 ईयर्स के बच्चे ने, जो एडोलेसेंट है, ही इज अ यंग एडल्ट, ही इज गोइंग टू गो आउट इनटू द बैड वर्ल्ड, उसको स्वीट चाहिए और आपने मना किया एंड ही स्टार्ट्स doing toward forward, then you say there's something very wrong with it. So that is the basic thing that we are looking at. We are looking at the fact कि अगर बच्चे को कुछ ट्रीटमेंट की जरूरत है, so the most important thing is क्या उसकी age appropriate behavior है या नहीं. Number 2, we also look at the fact कि उसके social skills है या नहीं. हम लोग, we are supposed to be social creatures. तो it is necessary for us कि हमारी जो behaviors hai with other people, कि I can wait for my turn, I can answer when I'm asked, I enjoy other people, I enjoy socializing. मैं जब बाहर जाता हूँ तो मुझे डर नहीं लगता है, मैं दूसरे के सामने मेरी व्यू पॉइंट्स शो कर सकता हूँ. ये सब जो है वो बहुत ही इंपॉर्टेंट है. एंड इट ऑल स्टार्ट्स विद यंगस्टर्स. इट इज नॉट कि आप चाइल्डहुड में कुछ नहीं कहे, कुछ आपका बिहेवियर नहीं हो सोशली, एंड सडनली आप 20 साल के हो जाओगे और कुछ चमत्कार होगा और आप अच्छी तरह से बात कर सकोगे. ऐसा तो होता नहीं है. थर्ड पार्ट विच आई हैड स्पोकन अबाउट इज रेगुलेशन ऑफ इमोशन. अभी इसका क्या मतलब हुआ? वी ऑल फील थिंग्स. कभी मुझे बुरा लगेगा, कभी मुझे बहुत खुशी होगी. लेकिन अगर जब मुझे बुरा लगे तो मैं तोड़ फोड़ करूं, या मैं अपना सर पटकूं, या किसी और को मारूं, दैट इज नॉट कंसिडर्ड नॉर्मल. अगर मुझे बहुत खुशी है तो मैं, मतलब आई स्टार्ट स्पेंडिंग टू मच मनी, आई स्टार्ट जंपिंग अराउंड, आई डोंट स्लीप, दैट अगेन इज नॉट नॉर्मल. तो ये जो नॉर्मल सी की जो बात होती है, विच मोस्ट ऑफ अस आर अवेयर ऑफ, दैट इज प्रोबेबली द मोस्ट इंपॉर्टेंट एस्पेक्ट एसोसिएटेड विद रेगुलेशन ऑफ आवर इमोशंस. और ये जब ऊपर नीचे बहुत ज्यादा होता है तो उसकी वजह से कभी कभी वो नॉर्मल फंक्शनिंग जो हम बोलते हैं स्कूल में, घर में और सोशल सिचुएशंस में, हम देखते नहीं है, एंड दैट बिकम्स अ मेजर प्रॉब्लम. सो व्हाट डज दैट मीन? सोशल फंक्शनिंग एट होम. इफ मम्मी सेज यू हैव टू गेट अप इन द मॉर्निंग, यू हैव टू हेल्प मी इन द हाउस अ लिटिल बिट, फिर आपको ट्यूशन के लिए जाना है, आपको पढ़ाई करनी है, फिर पापा बोलते हैं कि शाम को हम वॉक के लिए जाएंगे, एंड यू फाइंड इट एब्सोल्युटली इम्पॉसिबल टू डू सो. If you are in school and the teacher says आपको ये homework देनी है कल, and you find it impossible to give it up, आपकी चंचलता बहुत है, you find it very difficult to sit in one place, you're disrupting other children, you're shouting and screaming when you're not supposed to, or you're very very quiet. कभी कभी क्या होता है कि we only look at people जो disrupt करते हैं दूसरे लोगों को. We don't look at a very very quiet child who doesn't say anything, who seems within himself. अगर बिग क्लासेस हो तो हम इतने खुश है कि अभी ये बच्चा जो है एकदम चुपचाप बैठे तो आई कैन गो अहेड विद लाइफ. बट वी डोंट रियलाइज दैट वो ज्यादा चुपचाप बैठना भी एक प्रॉब्लम हो सकता है. Without treatment, these mental health conditions can prevent children from reaching their full potential. मान लो कि बच्चा जो है वो बहुत ज्यादा होशियार है, लेकिन अगर उसकी कंसंट्रेशन बहुत कम है, अगर वो अटेंशन नहीं दे सकता है, अगर उसकी वजह से he doesn't give up his work on time, आपने पेपर दिया उसको 1A 1B 1C 1D 2A 2B 2C 2D, उसको सब आंसर्स मतलब he knows them all, but still क्योंकि उसकी attention कम है, he will skip answers and then his actual potential will not be reached. A number of adults who come to us for mental health reflect on the impact of mental health disorders in their childhood and they wish they had received help sooner. बहुत बार हम लोग देखते हैं कि जो अडल्ट्स आते हैं वो बोलते हैं कि काश जब मैं छोटा था तब मुझे अच्छा ट्रीटमेंट मिल जाता, तो फिर मुझे ये जो रेसिड्यूल डैमेज जो है, जो मैं बैगेज, मेंटल हेल्थ बैगेज में अपने शोल्डर्स पे बोझ की तरह से मैं ले रहा हूँ, वो नहीं रहता. सो इट इज एसेंशियल दैट वी ट्रीट द mental health disorder in childhood as early as possible. अभी कभी parents and teachers बोलते हैं, isn't that normal part of growing up? Which is quite true. We don't want कि बच्चा एकदम चुपचाप बैठे रहे, अगर आपने बोला उठो तो वो उठे, अगर आपने बोला बैठो तो वो बैठे. He's not a little robot, he's not a little piece of stone or a piece of wood. जो differences होती है behavior में, उसकी वजह से it adds to the रौनक in our environment. But when does it become cause for concern? In general, अगर ये inappropriate behavior हो, जो अपने को लगे कि ये बराबर नहीं है, जिस तरह से वो behave कर रहा है उसमें कोई problem है, and if it persists for a very long time period, that is a problem. अगर उसकी behavior की वजह से you get distressed, family में distress होता है, family को लगता है ये problem है, family को affect होता है, people don't sleep, people get scared, people get very angry, then that is a problem. If it interferes with the child's functioning at school, home or with friends, अगर वो दूसरे बच्चों के साथ खेल ही नहीं सकता है, when he goes down to the playground, people run away from him and they say मेरे साथ मत खेल because you don't know how to play. If at school the teachers are constantly complaining, the teachers are constantly calling the parents home, parents to school and saying बहुत complaints आ रहे हैं दूसरे बच्चे के parents से, वो बोलते हैं कि आप कुछ नहीं कर रहे हो स्कूल में, your son is beating up my daughter, ये क्या हो रहा है? If the behavior is unsafe, आजकल we are seeing a lot of this. अर्चना मैडम ने सुसाइड के बारे में काफी जिक्र की थी, and I'm going to be talking about that because that's one of the most frightening and the most difficult things to cope with. अगर बच्चे की बिहेवियर की वजह से हम लोग सेफ्टी के बारे में सोचने लगे, we start thinking that the child is either unsafe to himself, where he says काश कि मैं मर जाऊं, काश कि मैं कुछ करूं अपने आप को, what is the purpose of living, people don't like me at all, I would be better off dead. अगर मैं जिंदा नहीं रहा तो फिर मेरे पेरेंट्स जो है वो 10 दिन के लिए रोएंगे और उसके बाद they'll be okay. ये तो हर रोज मुझे देख के मुझे डांटते रहते हैं, I'm a useless person. If these thoughts are constantly on, then that is unsafe behavior. In addition, kabhi-kabhi aajkal, in fact, today I read a paper also. When I opened the paper, we saw there was this kid who got angry and he picked up a knife and he hit his best friend. These kind of things are becoming very, very commonplace and they're very frightening. So, agar bachche ki behavior has a trend towards being unsafe, either to himself or to other people, then that is a problem. What do we see in young children? अभी बच्चे लोग बहुत कुछ करते हैं. Some of it is considered normal, some is not considered normal. So what do we look at? अगर बहुत ज्यादा temper tantrums normal है. A child is trying to find out his limits. He's trying to find out how far he can go. He's trying to find out कि मैं क्या कर सकता हूँ, मुझे क्या मिलेगा. अगर मुझे कुछ चीज चाहिए और मम्मी ने मना कर लिया, अगर मैंने किया तो वो इरिटेट हो जाएगी और मुझे मिल जाएगा, तो उनकी टेम्पर टैंट्रम्स जो है वो इंक्रीज हो सकती है. इफ ही इज इंटेंसली इरिटेबल, कभी कभी हम लोग सोचते हैं बच्चों के बारे में, एंड आई टेल पेरेंट्स एंड आई टेल टीचर्स, डिस्क्राइब हिम हिज बिहेवियर इन वन वर्ड. सो दे विल से ही इज अ हैप्पी चाइल्ड, ही इज अ क्रिएटिव चाइल्ड. और कभी कभी बोलते हैं ही इज वेरी इरिटेबल, ही इज ऑलवेज एंग्री, ही इज वेरी एजी. That is not normal behavior. हम लोग सभी कभी कभी इरिटेबल हो सकते हैं, सब लोग जो है कभी कभी गुस्सा करते हैं, सब लोग जो है कभी कभी बहुत खुश रहते हैं. But if you're constantly intensely irritable, then that needs to be looked at. If there are constant fears and worries, अभी लोग कभी कभी बोलते हैं कि मैं I worry about people. कभी बच्चे आते हैं और बोलते हैं I can't get over the fear of darkness. अभी ये fear of darkness is a very common thing. लेकिन अगर इस हद तक हुआ कि he just cannot go into the bathroom at night, he's about 10 years old or 12 years old and he cannot go into the bathroom at night, he cannot sleep alone at night, he hears any noise and he wakes up screaming, uske nightmares बहुत होते हैं, then there's something wrong happening over there which we have to look at. In children, the one thing that most of us forget is constant somatic symptoms with no medical cause. मेरा सर दर्द हो रहा है, मेरा छाती में दर्द हो रहा है, मेरे पेट का दर्द हो रहा है. You go to the doctor, sometimes the doctor does investigations to come to a conclusion. Lekin you find nothing wrong and then finally the doctor will say go and meet a psychiatrist. Constant somatic symptoms. Kabhi-kabhi that is the only symptom of a mental health disturbance in a child. Constant motion. Abhi chanchalta bahut achhi cheez hai. We want kids to be active. We don't want them to sit down quietly. We don't want them to be quiet. We don't want them not to talk. Lekin agar it is inappropriate, if they just can't sit, if they find it so very difficult to sit in one place that they're disturbing others, they're shouting, they're screaming. Kabhi kabhi mere clinic mein bachcha aata hai, he comes running in, he sits on the chair opposite me, he drops my bell, he drops my pen. Udhar ek sheaf of papers hota hai, he pull the sheaf out and he'll throw it around and he'll go hey, hey, hey. And I look at the child and I say, chalo theek hai, we have some idea as to what is possibly happening. So if there is constant motion, that becomes an issue. आजकल के जमाने में sleep has become a major issue, especially after COVID. I mean, COVID had a lot of problems, and one of the most important problems was sleep. क्या होता था कि आपको स्कूल के लिए उठना नहीं पड़ता था सुबह. You could get up late. You didn't have to go in a school bus. You could sit at home. So you had about 2 hours free. Because of that, you could get up late. Because you could get up late, you could sleep late. तो रात को चलो क्या करें हम लोग, कुछ YouTube पे देखे, कुछ सीरियल देखे, and sleep became a major issue. आजकल जब schools have opened again, we have a lot of children, especially who come in the mornings, if they have a morning shift, which makes them start at about 7 o'clock. उनको बहुत तकलीफ हो रही है. Difficulty with socialization, I've already spoken about that, and that's probably one of the most important things. अगर आप ये सोचे कि some of the adults हो गए, अगर आप लोग सोचे कि आपके पास कोई friend ना हो, then that's terrible. अगर आपको लगे कि आपके सब friends जो है वो आपके विरुद्ध सोचते हैं, आपके opposition करते हैं, those are horrible thoughts to think. If I get up thinking that everybody is against me after me, that makes me very uncomfortable. Academic issues. अभी स्कूल में तो that is the most important thing, school and college. तो अगर आपको लगे, आपके पेरेंट्स को लगे, आपके टीचर्स को लगे कि आप में बुद्धि बहुत अच्छी है, लेकिन आपके रिजल्ट्स जो है they are not very good because of various issues. So then we look at the various problems. क्या concentration में problem है, basic IQ थोड़ी कम है, intellectual problems है, क्या आपको learning disability है, attentional problems है, आपकी emotional content इतनी ज्यादा हो गई है कि वो emotionality की वजह से you're not able to focus well. All of these things can be looked at. Then we have this thing of repetitive actions. You're keeping on checking things. Once again, we've seen a lot of that after COVID. तो अगर मैंने आपको कुछ papers दिए और आपने 10 बार उसको count किया तो वो थोड़ा ज्यादा है. You go into the toilet and you've been told COVID के time पे कि you had to hand wash yourself. तो आपने 1 बार किया, 2 बार किया, वो ठीक है. लेकिन अगर आप 10 बार, 20 बार, 30 बार, 40 बार करते रहे, then that is inappropriate. That is something that we are seeing a lot of. That becomes a problem. और उसी प्रकार से religion sometimes becomes a problem. I believe in God. मैं pray करता हूँ. I will spend half an hour at the very most praying. If I spend 10 hours a day praying and I feel very bad and I say, अरे वो मेरा prayer जो है पूरा नहीं हुआ, God को बुरा लगेगा, He will do something bad to me. Those are frightening things, and because of that, you have varieties of what we call OCD, obsessive compulsive disorder, even associated with religion. So that is another very major thing that we see. For the older child and for the adolescent, one thing is what we call anhedonia. Anhedonia का मतलब क्या हुआ कि मुझे कोई satisfaction है ही नहीं, मुझे किसी चीज में मजा नहीं आता है. I used to like playing cricket. अभी वो उसमें भी कोई दिलचस्पी नहीं है. I used to like going and watching movies. Now I don't feel like getting out. I don't feel satisfaction with anything. मुझे किसी चीज की satisfaction नहीं है, and that is called anhedonia. It's very often found when you are depressed. Low energy. अभी low energy तो प्रकार की हो सकती है, अलग-अलग सी हो सकती है. It could be related to the fact that you are anemic. It could be related to the fact that you have low iron, low folic acid, low B12, low D3, वो सब है. But low energy is also often associated with mental health issues. अगर आप डिप्रेस रहे, बहुत घबराहट हो, तो very often आपको लगता है कि मुझे कोई एनर्जी नहीं है, and then the patient will come up to you and the parents will say, अरे ये पूरा दिन सोता ही रहता है, उसमें कोई एनर्जी नहीं है. और हमने सब तपास कर लिए because we were worried कि उसके कोई प्रॉब्लम्स है, but physical तो कुछ है ही नहीं, तो mental कुछ प्रॉब्लम होगा. Being alone, lack of socialization, that again we see a lot in kids and adolescents, and this is very important. For the older child, being part of a group is extremely important. So you have to become part of a group. You can become a good group where you have groups where you're doing sports, or you're talking about going to the gym, or you're talking about a book club. And you can have bad groups where you talk about pornography, or you do stuff related to sexuality, or you talk about drugs. The point is, group identity and group formation are extremely important in adolescence. They make you feel connected with the rest of the world. They make you feel that you're part of a bigger community. और अगर आप कोई भी ग्रुप में नहीं रहे तो फिर उसका प्रॉब्लम हो सकता है. You start feeling there's something inadequately wrong with you. You start feeling that nobody likes you. You start feeling that people don't care for you, and that becomes a major issue. So this is again something that we look at. The possibility of being alone to some extent is okay, but beyond that, वो पूरा टाइम रूम में ही बैठता है, किसी से बात नहीं करता है, बाहर नहीं जाता है. हम लोग बाहर जाते हैं तो दिखता नहीं है. किसी ने फोन किया तो वो फोन नहीं उठाता है. फ्रेंड्स आते हैं तो वो मम्मी को बोलता है उनको बोल दो मैं घर पे नहीं हूं. दिस कटिंग ऑफ इज नॉट अ गुड थिंग. ईटिंग इश्यूज. Eating has also become a very major issue, especially in adolescence. हमारे जो मिस वर्ल्ड और मिस यूनिवर्स हुए उसका बहुत अच्छा हुआ, लेकिन उसके साथ साथ a lot of ladies started wanting to become this zero body image जो है, and that becomes a major issue. So you have all these fads which come in, the cucumber diet and pineapple diet and all that nonsense that is happening, जिसकी वजह से हमारी जो body के जो constituents होनी चाहिए उसमें काफी problems आ जाते हैं. Then we'll end up having a whole bunch of issues. In ladies, it's very, very important because it affects periods, and that becomes a very major issue. Sometimes you even have situations जहाँ मम्मी भी करती है और उसके बाद बच्ची भी करती है. That becomes quite sad. Self-harm behaviors, उसके बारे में मैंने थोड़ा जिक्र किया, and we'll talk about that more in a later stage. Addictions. Whenever you open a newspaper, you're seeing कि किसी ने either raid किया and you get 250 crores of heroin and you get so much of ganja and you get MDMAs and all of that. In the big cities, it's become a major issue. Unfortunately, even in the smaller villages and the smaller towns, everybody is seeing an increase in this kind of problem. The biggest addiction, of course, is cigarettes. Nobody considers cigarettes to be a very major issue, लेकिन cigarettes से सब कुछ शुरू होता है. So it's horrible when you see 13, 14, 15-year-olds smoking away and they think that मैं तो सबका राजा हूँ, but you're not. You're just an idiot. You also end up seeing a lot of alcohol up the intake, and unfortunately, maybe the strictness that should be associated with allowing kids to pick up booze from shops or to enter pubs may not be as strict as it should be, and that becomes a major issue. Related to all of that, then you have drunken driving, and you have the accidents that we see, and you have issues relating to sexuality and all, which is a very, very sad state of affairs. Suicide के बारे में हमने जिक्र किया था. Sometimes you have the other end of the spectrum. You have too much energy, so you don't sleep and you eat too much, and you feel that you have the answers to the universe and you know everything about everything and everybody else is a fool. This is a state of excitement, and just like depression is very sad, जहाँ पे आप की energy level बहुत कम है and you don't feel like doing anything, and because of that you don't end up doing anything. At the same time, you have elevated energy and you have elevated activity over a period of time, which can also become a very major problem. So that is again something that we look at. And then you have what we call hallucinations. Hallucination का मतलब क्या हुआ कि आप कुछ देख रहे हो, या आप कुछ फील कर रहे हो, या आप कुछ सुन रहे हो, या आपको कोई आवाज आ रही है जो असलियत में नहीं है. So I can hear voices and I look around and I don't find anybody. And I'm watching television and I'm saying, अरे वो television का जो program चल रहा है, it is directed towards me and it's passing me messages. Or I'm looking at a YouTube message and I'm saying, अरे वो YouTube जो है, it is giving me a message, it is telling me information. I'm walking on the road and somebody's blowing a horn and I look at him and I know that he's after me because he knows I know he's from the CBI and he's against me. These are all hallucinatory things which are very, very frightening to the person and which cause a lot of problems, and they are part of some of the major psychosis that we see. So certainly this is something that we need to look at. Let's start with one of the most common conditions, जिसको हम attention deficit hyperactive disorder बोलते हैं. Now we've all heard about this. We all know कि कई
Sir,
बच्चे
may
हैं.
I interrupt, sir?
Yes, sir.
Sir, there are 2-3 comments coming. If you could use more of Hindi.
Sure. Okay. जरूर. तो हमें attention deficit disorder के बारे में तो बहुत ज्यादा awareness तो already है. Basically क्या होता है, अगर बच्चा जो है वो बैठ नहीं पाता है, जिसकी normal sitting capacity जो है वो बहुत ज्यादा कम हो जाती है, वो और अगर वो बैठा तो उसको बहुत restless होता है, वो बैठ नहीं पाता है अच्छी तरह से. So you ask him to do something और वो कभी-कभी उसकी delayed reactions होती हैं. He normally doesn't give up books on time. अगर उसको homework मंडे को देना था तो वो मंडे को आएगा और बोलेगा मैडम मैं रात को देता हूँ, मैं कल देता हूँ, ये सब। वेरी ऑफन ही लूजेस थिंग्स। उसका जो पेन है, उसकी जो बुक्स है, वो बोलता है कि अरे मुझे पता था, मैंने बैग में रखा लेकिन वो आया नहीं, वो मिलता नहीं है मुझे, अभी मैं क्या करूँ। वो जनरली इट्स अ पेन, जिसको हम अटेंशन डेफिसिट हाइपर एक्टिव डिसऑर्डर बोलते हैं। अगर एडीएचडी जो है, और उसका एक भाग है एडीडी, जहां पे आपको अटेंशन की प्रॉब्लम है लेकिन आप हाइपर एक्टिव नहीं है, आपकी चंचलता इतना नहीं है। अनफॉर्चुनेटली ये जो है, उसकी जो परसेंटेज है वो बढ़ती जा रही है। वी आर सीइंग कि ऑलमोस्ट 12% ऑफ द पॉपुलेशन को ये है। अगर मान लो कि आपके क्लास में 50 बच्चे हैं, तो अबाउट 6 to 10 ऑफ देम विल हैव दिस काइंड ऑफ अ प्रॉब्लम। एंड द प्रॉब्लम इज आल्सो कि इट्स नॉट नॉर्मली कि आपको सिर्फ अटेंशन डेफिसिट की प्रॉब्लम है, उसके साथ साथ और भी एसोसिएटेड प्रॉब्लम्स हम देखते हैं। बट इफ यू आर लुकिंग एट अटेंशन डेफिसिट प्रॉब्लम्स, एक टाइम था व्हेन आई वाज अ मेडिकल स्टूडेंट, जब हम इसके बारे में बात करते थे तो हम बोलते थे कि ये सिर्फ बॉयज में दिखाई देता है एंड मे बी 1% ऑफ गर्ल्स में है। आजकल हम गर्ल्स में भी देखते हैं, बहुत ज्यादा देखते हैं। इट परसिस्ट इन अडल्टहुड। वंस अगेन जब हमने शुरुआत की थी ये पढ़ने के बारे, इसके बारे में पढ़ना, तो हमें कहा जाता था कि बाय द टाइम द चाइल्ड इज इन हिज लेट टीन्स, जब वो 19-20 साल तक हो जाता है, तब उसकी ये जो प्रॉब्लम है वो कम हो जाती है, बिकॉज न्यूरोलॉजी में उसके नर्वस सिस्टम में मेच्योरेशन आ जाता है और प्री बिकम्स ओके। आजकल तो हमें पता है कि दिस परसिस्ट इन अडल्टहुड। तो एज मच एज 50, 60, 70% बच्चे जो है, उनकी जो ट्रीटमेंट अगर आपने बराबर नहीं की बचपन में, तो वेरी ऑफन वी फाइंड कि दिस कंटिन्यूज इवन इन अडल्टहुड। तो यू हैव अडल्ट्स जिसको अटेंशन डेफिसिट डिसऑर्डर होता है। नॉर्मली हाइपर एक्टिविटी नहीं होती है अडल्टहुड में, लेकिन अगर आपने कोई 30, 40, 50 ईयर ओल्ड को मान लो जर्नल दिया और उनको बोला कि ये टॉपिक पे ये जो आर्टिकल है उसको पढ़ो, तो उसको बहुत प्रॉब्लम होगा। वो रेस्टलेस रहेगा, थोड़ा बहुत वो बैठ नहीं पाएगा। और आप बोलोगे चंद्रिता व्हाई कांट यू बी कंफर्टेबल, व्हाई कांट यू बी काम, और वो बोलता है पता नहीं अंदर से कुछ हो रहा है जिसकी वजह से मैं बैठ नहीं पाता हूँ। सो दिस इज समथिंग दैट वी सी इवन इन अडल्ट्स। व्हाई इज इट इंपॉर्टेंट टू ट्रीट? एक तो अगर एडीएचडी ज्यादा हो तो फिर यू आर एट इंक्रीज रिस्क फॉर एकेडमिक, सोशल, फंक्शनल, बिहेवियरल एंड फैमिली डिसफंक्शन। मान लो कि कोई अच्छी तरह से बात में बैठ नहीं पाता है, मान लो कि वो अनपंक्चुअल है ऑल द टाइम, वो टाइम पे नहीं कुछ कर सकता है, उसको रिएक्शन ज्यादा है, ही डजंट रिस्पॉन्ड, ही रिएक्ट्स। वो चल रहा है, कोई बाय मिस्टेक उसको टच करता है और वो इमीडिएटली पुश करता है, वो दूसरा गिर के उसको चोट लगती है। सो दिस इज द काइंड ऑफ थिंग वी सी अ लॉट ऑफ रिएक्शंस रादर देन एक्चुअली थिंकिंग आउट कि अगर मैंने ऐसा रिस्पॉन्ड किया तो उसका क्या नतीजा होगा। सो वी फाइंड किड्स नॉट सीइंग व्हाट दे गोइंग टू डू इन टर्म्स ऑफ द रिएक्शन एंड द आउटकम इट विल ब्रिंग। अगर फैमिली में एक दो ऐसे बच्चे रहे तो बिकम्स वेरी डिसफंक्शनल। पेरेंट्स जो है बिकम्स वेरी वेरी डिफिकल्ट फॉर देम टू कोप। और अगर आप टीचर रहे और आप क्लास में रहे और क्लास में बच्चे लोगों को सिखाए और बच्चे 4, 5, 6, 7 बच्चे को ये प्रॉब्लम हो एंड दे आर नॉट गेटिंग एनी ट्रीटमेंट फॉर इट, देन इट बिकम्स अ मेजर इशू फॉर क्लास कंट्रोल। जो क्लास डिसिप्लिन होनी चाहिए उसमें बहुत प्रॉब्लम्स आ जाती है। उसके साथ साथ a lot of them also have special educational needs. The commonest comorbid with them जिसके साथ ये होता है is something called learning disability, जिसके बारे में हम बात करेंगे। तो अगर आपको learning disability हो and attention deficit हो तो each of them makes the other worse. एक की फर्स्ट की वजह से दूसरा जो है उसमें प्रॉब्लम आ जाएगा और दूसरी चीज की वजह से the first also gets aggravated. So it becomes a very major issue. बच्चा जो ADHD, बच्चे में जो अगर ADHD हो तो पेरेंट्स को बहुत प्रॉब्लम आ जाती है। द चाइल्ड इज वेरी डिफिकल्ट टू कंट्रोल एंड इट बिकम्स अ मेजर इशू। एंड अनफॉर्चुनेटली जैसे मैंने कहा था कि यू आर नॉट एक्चुअली थिंकिंग अबाउट द फ्यूचर, यू आर नॉट एक्चुअली थिंकिंग प्रॉपर्ली अबाउट द रिएक्शन टू व्हाट इज हैपनिंग, यू जस्ट रिस्पॉन्ड विद फटाक करके एंड यू लैंड अप डूइंग थिंग्स व्हिच आर स्टूपिड। तो उसकी वजह से यू कैन हैव इंक्रीज रेट्स ऑफ सब्सटेंस अब्यूज, मतलब ड्रग एडिक्शन, sexually transmitted diseases, because you don't see what you're doing उस टाइम पे आपकी इमोशन की वजह से you give into sexuality, और आप शायद you don't take precautions and you'll end up having this। और वो लोगों ने ये भी रिसर्च से पता चल गया है कि व्हीकल एक्सीडेंट्स में परसेंटेज ऑफ पीपल जिनको डायग्नोसिस था ADHD का या ADD का, उनकी परसेंटेज में व्हीकल एक्सीडेंट्स ज्यादा है। What are the causes? There are lots of causes. Nowadays हम लोग जो ही सोचते हैं ना, कभी कभी लोग बोलते थे कि आपको पता कैसा है कि ये प्रॉब्लम है, आप तो कुछ देख तो नहीं सकते. आजकल जीन्स हैव बिकम वेरी बिग. हमारे अंदर जो डीएनए होता है, जो जीन्स होता है, वो जीन स्ट्रक्चर को अपने, हमारे पास इतनी रिसर्च हो गई है कि वो जीन्स से अपने को बहुत कुछ पता चल जाता है. एंड नॉर्मली नाउ आई कैन इवन आइडेंटिफाई इन एडवांस, अगर मैंने जेनेटिक स्टडी किया कि मम्मी को ये प्रॉब्लम है, पापा को ये प्रॉब्लम है, कि बच्चे को भी ये होगा कि नहीं. There are certain parts of the genes which we call alleles and SNPs and things like that, जिससे अपने को पता चल जाएगा कि बच्चे को ये प्रॉब्लम है, and we can even find out whether he is going to respond properly to a particular kind of medication. दूसरी बात है, हम लोग आजकल हमारी जो रेडियोलॉजिकल डिवाइसेस है, एफएमआरआई, पेट स्कैन, उससे we can actually see structural changes in the brain. तो a child without ADHD and a child with ADHD, उसमें काफी डिफरेंसेस होती है उनके ब्रेन स्ट्रक्चर में. और अगर मैंने वो ब्रेन स्ट्रक्चर को देखा तो आई कैन एक्चुअली प्रोफेसाई इन एडवांस कि मुझे पता नहीं है, बच्चे को मैंने कभी देखा नहीं है, मैंने एफएमआरआई देखा और मैंने बोला कि इसको ये प्रॉब्लम है, फ्रंटल लोब में ये प्रॉब्लम है, पैराइटल लोब में ये प्रॉब्लम है, कॉर्पस कैलोसम में ये प्रॉब्लम है, और मैं बोल सकता हूँ कि मेरा ख्याल है कि बच्चे को ये प्रॉब्लम हो सकता है. So we are actually being able to see structural changes. It's no longer things like बच्चे को बचपन में दूध नहीं पिलाया गया, मम्मी बहुत स्ट्रिक्ट थी. That might help to some extent, but now we can actually see changes in the brain, which is a very, very, very big thing. I mean, these are the things that we see for those who are doctors speaking. I was not sure कि अगर doctors भी रहे तो उनको भी थोड़ी biological दिखाए. तो ये सब brain structures में changes है, certain structures in the brain get affected. There is connections जो होते हैं. We talk about electronic circuits from the frontal to the frontal brain to lobe to the occipital lobe. उसमें थोड़ी सी problems है. The last thing you can see कि genetics का थोड़ा सा problem है. There are electronic circuits in the brain जिसको हम बोलते हैं. तो those circuits also get affected in children, and different circuits get affected in adults. और ये circuit affectation की वजह से ही ये problem हम लोग देखते हैं. How does the child present in school? बच्चे लोगों में स्कूल में hyperactivity. तो अगर बच्चा स्कूल में रहा और आपने देखा, आप say you are looking at a group of kids, 30-40 बच्चे हैं, you can actually look at them and say वो 6-7 बच्चे जो है they are not paying attention, वो अच्छी तरह से बैठते नहीं हैं, वो अपने ही माइंड में कुछ कर रहे हैं. अगर टीचर ने उनको कुछ पूछा तो वो जवाब नहीं दे पा रहे हैं, और they say, "Sorry, I didn't hear, I didn't pay attention, sorry miss, sorry miss." That's very, very commonly found. तो प्री स्कूल में हाइपर एक्टिविटी होती है, स्कूल एज में इनअटेंशन होता है. प्यूबर्टी के बाद वो हाइपर एक्टिविटी, इंपल्सिव बिहेवियर्स थोड़ी कम हो. प्यूबर्टी इज अबाउट 12, 13, 14. तो उसके बाद थोड़ी वो कम होती है. They are a little more calm, they are a little more composed, लेकिन अटेंशन का प्रॉब्लम रहता ही है. प्लस कभी कभी वो ज्यादा बात करते हैं, रेकलेसनेस दिखाते हैं, they take risks, और उनकी डिसीजन मेकिंग थोड़ी कम है. How do we diagnose it? Every child who is restless doesn't have this problem. Every person who talks too much doesn't have this problem. तो हमारे पास एक तो you have to take him to a person like me. डॉक्टर के पास ले जाओ और डॉक्टर इवैल्यूएट करेगा. He'll do a clinical evaluation, find out family history, look at the person. Plus, there are certain criteria that are followed. DSM is our main मैनुअल, डॉक्टर लोग का मैनुअल है, साइकियाट्रिस्ट का मैनुअल है, जिसको हम डायग्नोस्टिक एंड स्टैटिस्टिकल मैनुअल बोलते हैं. द 5 इज द लेटेस्ट वन, और उसमें देयर आर सर्टेन क्राइटेरिया वी हैव टू फॉलो, जिसकी वजह से अपने को पता चल जाएगा कि बच्चे का जो इनअटेंशन है या उसकी जो चंचलता है, इट्स अ लिटिल टू मच देन व्हाट इट शुड बी. बट द मोस्ट इंपॉर्टेंट थिंग आल्सो इज कि हमें एटलीस्ट 2 सेटिंग्स में ये बिहेवियर देखनी चाहिए. अगर वो सिर्फ स्कूल में ये दिखाता है, देन देयर इज समथिंग दैट मे बी समथिंग एल्स. अगर मम्मी आके बोलती है कि वो स्कूल में इतनी अच्छी तरह से बिहेव करता है, घर में ही ड्राइव्स अस क्रेजी, then this is again may not be attention deficit disorder, it could be some other behavioral problem. So 2 settings में होनी चाहिए. स्कूल में, घर में, फ्रेंड्स के साथ, बाहर ले जाओ, गार्डन में. If the behavior is bad in at least 2 settings, then we start thinking that there may actually be a problem, and then we look at it in terms of हमें क्या करना चाहिए. स्केल्स होते हैं. तो there are certain scales. जब when an attention deficit disorder child comes to me, मैं पेरेंट्स को देता हूँ and they go टिक 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 कि वो ये करता है, वो ये करता है, वो ये करता है. We give it to schools. Teachers write and they say कि वो बच्चा इस तरह से बिहेव करता है. We give it to the peers. उनके फ्रेंड्स के पास. So friends say कि वो हमारी तरह से हमारे साथ इस तरह से बिहेवियर करता है. We don't like him next to us. He's too much of a bully. He doesn't listen to us. He doesn't wait for his turn. वो क्रिकेटिंग करता है तो he bats and then when it's stumped the ball he says अरे मैं बोर हो गया हूँ, मैं निकल जाता हूँ. Those are things which are very bad. So these are the things that we look at. We look at it in terms of scales. But the most important thing is कि आप कोई अच्छे डॉक्टर के पास ले जाओ तो वो देखेगा और वो बोलेगा कि उसको ये प्रॉब्लम है या नहीं है. जैसे मैंने बताया उसके साथ there are lots of other problems. There is something called ODD which is oppositional defiant disorder जिसके बारे में भी मैं बात करता हूँ because it's very important और आजकल हम बहुत देखते हैं इसके बारे में schools में, colleges में etc. हम लोग एंजाइटी और मूड के बारे में तो अपने को पता ही है थोड़ा बहुत कि घबराहट क्या चीज है और डिप्रेशन क्या चीज है, उसके बारे में भी हम जिक्र करेंगे. Conduct disorder is something which is not so very common लेकिन हम देखते हैं. And then we have tics. तो टिक का मतलब हुआ ये जो if I have this involuntary movement जो मैं कंट्रोल करना चाहता हूँ लेकिन इससे कंट्रोल नहीं होता है very often. So that's called a tic. और ये ADHD के साथ हम लोग बहुत टिक्स देखते हैं. What is the treatment? That is most important. हमने डायग्नोज किया, अगर डायग्नोज किया उसके बाद हम क्या करें? First is you have to educate people. Lots of people get angry. Okay, keep quiet, shut up. क्या कर रहे हो? अभी उसका कोई मतलब बनता नहीं है. He's not doing it on purpose. और मैं ये एग्जांपल देता हूँ कि मान लो कि आपको अस्थमा है. बहुत लोगों को अस्थमा रहता है. You have a breathing problem. मान लो कि आपको अस्थमा है और आप क्लास में हो और आपको एस्थमेटिक अटैक आता है, ब्रेथलेसनेस का प्रॉब्लम. टीचर लोग क्या करेंगे, बच्चे लोग क्या करेंगे? they'll go around, they'll say अरे डोंट वरी, पंप है क्या, मैं पंप देता हूँ, आराम करो, चुपचाप बैठो, give him place. You're not going to shout at him and say how dare you have an asthmatic attack, क्या है, I'm going to throw you out of the class. आप तो वैसे तो नहीं करोगे. Why? Because you can see it. अगर बच्चे को अटेंशन डेफिसिट हाइपर एक्टिव डिसऑर्डर है तो उसको एक प्रॉब्लम है, उसको एक बीमारी है जो आप नहीं दे पाते हो. लेकिन देखना, आप देख नहीं पाते हो उसका ये मतलब नहीं हुआ कि आप उसके प्रॉब्लम नहीं है. तो इफ ही हैज अ प्रॉब्लम वी हैव टू डील विद इट. और हमें पता है कि इफ आई शाउट एट हिम एंड से क्यों नहीं बैठ सकता है, कम एंड सिट हियर, व्हाट इज रॉन्ग विद यू, व्हाई यू नॉट गिविंग अप, चिल्लाने और चीखने से उसकी जो एंजाइटी है वो बढ़ेगी. और अगर एंजाइटी बढ़ गई तो उसके जो इनिशियल प्रॉब्लम्स है वो उसमें बढ़ावा आ जाएगा. So you're going to have an aggravation of the problem. So your problem जो इतना था 10%, 20%, you start shouting and screaming at him, it will become 50%. So the first thing जो हम लोग बोलते हैं टीचर लोगों को, because we keep having these programs for teachers, is don't get angry. Now that doesn't mean the child can do whatever he wants. हम ये तो नहीं बोल रहे हैं कि जो भी करना है उसको करने दो, but ये बोल रहा हूँ कि गुस्सा करने से और मारपीट तो होना ही नहीं चाहिए, because that is considered to be a crime now. वो तो होना ही नहीं चाहिए schools में. So that is something that we have to avoid. Behavioral interventions होते हैं. There are lots of things we can do जिससे उनकी behavior जो है वो काम हो जाती है. There is something called behavior modification, which is a 2-hour or 4-hour program in itself, which sometimes we can maybe do with teachers over a period of time. There are school interventions. See, one of the things is, for example, मैं teacher को बताऊं. Normally teacher लोग blackboard पे they write on the whole blackboard, right? ऊपर से शुरू करते हैं, नीचे लिखते हैं अंदर से, चलो बच्चे लोग ये सब आपके किताबों में लिखो. Now a child has attention deficit disorder, उसका concentration नहीं है इतना. There are 25 lines on the board. By the time he finishes, by the time he can concentrate, जब तक वो 10 या 12th या 13th line पे आए, टीचर बोलती है चलो it's over, now I'm going to rub the board. So he misses out on the lower part. तो हम लोग क्या एडवाइस देते हैं? We say divide the board into 2 parts. Draw a line in the middle और जो भी आपको लिखना है वो लेफ्ट साइड पे लिखो. When you finish with the left side, you start writing on the right side. So even though most of the class goes on to the right side, at least the left side का जो रहेगा board पे, बच्चा जो है वो थोड़ा slow है because of his attention deficit. He'll be able to catch up. उसका जो स्कूल का जो वर्क है, he will not come home with an empty book and show mummy and say, मम्मी मैं क्या करूं, I couldn't keep up with the class. So small little interventions like this make a lot of difference in a school situation. Jahan pe bacha, even though he's a little slow, still manages to keep up with most of the work done at school. And those are things that we teach teachers. What are the other things that we do? Medication. Abhi, medicines in children, everybody gets very frightened. अगर हमने दवाई दी तो क्या होगा, बच्चा जो है वो ज़ॉम्बी बन जाएगा, बच्चा जो है वो सोते रहेगा, बच्चा जो है वो किसी के कब्जे में आ जाएगा, all that nonsense that happens. So medicines are very very useful. हर एक बच्चे को हम दवाई नहीं देते हैं, लेकिन अगर चंचलता है, अगर अटेंशन डेफिसिट है, तो हम लोग देते हैं and then we see the change. बहुत बार बच्चे जो है they come and say at the 6th standard level and I tell the parents medicines शुरू करो and they say हाय हम नहीं करेंगे, and then they come back in the 8th standard and say चलो अभी हम शुरू करें. They've lost out on 2 good years. और those 2 good years अगर हमने अच्छी तरह से दवाई दी और उसका ऑब्जर्वेशन में रखा और उनको इवैल्यूएशन रेगुलरली दिए और उनका देखा कि वो किस प्रकार से वो उनका रिएक्शंस है and what we can do to modify etc, there would be a lot of change. Please do realize हमारी जो दवाई जो है it is for attention, it is not for his intelligence के लिए there is no medicine. तो कभी-कभी पेरेंट्स आते हैं और बोलते हैं अरे वो बहुत होशियार है, लेकिन होशियारी तो है, बहुत अच्छा है, he is very intelligent, लेकिन अगर उसमें अटेंशन कम है तो फिर वो नहीं कर पाएगा, और अगर वो नहीं कर पाए then that becomes a useless thing. अगर मेरे पास बुद्धि बहुत है लेकिन मैं वो बुद्धि को चैनलाइज नहीं कर सकूं because I'm so distracted, then that becomes a useless thing for me. तो अगर मैंने दवाई दी और उसकी वजह से मैं कंसंट्रेट कर सकता हूं, तो वो बुद्धि को मैं अच्छी तरह से यूज कर पाऊंगा, मार्क्स इंप्रूव होंगे, रिटेंशन विल बी बेटर, आई विल बी मोर प्रोडक्टिव एंड आई विल बी अ गुड मैन इन द कंट्री, instead of being a stupid fellow who runs around not being able to focus. So what are the 2 main tablets that we use? I'm just going to mention them. Either to doctor log, I don't think both doctors dekh rahe honge. The 2 main ones are something called methylphenidate and something called atomoxetine. Methylphenidate is the drug of choice. It's called a stimulant. Atomoxetine is a non-stimulant which also works on attention deficit hyperactive disorders. Have to be given under supervision of a psychiatrist. तो उसके मम्मी या चाचा या अंकल ने लिया था, उसको बहुत फायदा हुआ था, बच्चे को भी दो, ऐसा नहीं होता है. और उसके मम्मी या चाचा या अंकल ने बोला हाय हाय तुम बच्चे को कैसे ये दवाई दे सकते हो, ऐसा भी नहीं होता है. We have to give it if it's appropriate. Side effects, are there side effects? Yes. Commonest one is sleep का problem होता है. A lot of people feel के भूख कम हो जाती है. अभी हमारे इंडियन मदर्स को तो जब बच्चा आता है मोटा सा और हमारे पास आके बोलता है अरे उसको देखो इतना दुबला पतला हो गया, और हम देख के बोलते हैं रियली ही इज दुबला एंड पतला, बाप रे. सो पॉइंट इज इट इज इंपॉर्टेंट फॉर अस टू बी अवेयर ऑफ द फैक्ट कि देयर कुड बी सम एपेटाइट रिडक्शंस, और अगर बहुत एपेटाइट कम हो गया then we can't give the medication. Obviously I'm not going to give the medicine to stop from eating. Another very common side effect is headache, सर दर्द. तो अगर headaches increase हो जावे, regularly increase हो जावे, then we can't give it. Occasionally stomach issues होते हैं, occasionally emotional outbursts होता है, occasionally nausea and नींद ज़्यादा बढ़ सकती है. But about 80% of kids don't, 85% of kids do not have side effects. And what are the positives that we see? हम लोग ये देखते हैं कि the बच्चा can concentrate better, he can sit for a longer time period, he can give up his work on time, he doesn't lose things so often, he can wait for his turn, he can answer questions appropriately, he seems calmer. Now, one of the things, attention deficit disorder, there are 100 thoughts coming into your body, into your mind. And you say, wow, 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 so much is happening. I give you the medication, but when those 100 thoughts come in, goal-directed behavior is hardly 5. तो आपके पास 100 thoughts आएंगे, 100 विचार आएंगे, लेकिन आप hardly 3, 4, 5 चीज कर पाओगे. अगर मैंने ये दवाई दी, तो ये सब जो hogwash हो रहा है आपके ब्रेन में, वो कंट्रोल में आ जाएगा. So there will be 10 thoughts coming in, and all 10 thoughts you'll be able to deal with and reach a result. So कभी-कभी लोग बोलते हैं, अरे he's become, उसमें बहुत creativity थी, and you actually get into the history and you say, क्या creativity? What was he doing that was so great? He was doing nothing. He was just going on and on and on, और उससे तो कुछ होता नहीं है. Just doing things and not reaching a conclusion doesn't make sense. We have to do things to reach a conclusion. So one of the most important things. Growth issues also, we say कि अभी वो late research says कि इतना कुछ growth issues होता नहीं है. Deficits in weight also we say कि deficits इतने होते नहीं हैं. So there's not such a major problem. Teenagers को दवाई देना मुश्किल होता है and we find that they don't really continue, so we have to also do a lot of counseling and we have to tell them that you have to continue. लेकिन बहुत teenagers हैं जिनको खुद को पता चल जाता है कि अगर मैंने दवाई ली तो मेरा concentration जो है वो बहुत बढ़ता है and I get a lot of compliments in school and in college, so let me continue doing it because I know it makes a difference. So in all of these things, especially जहाँ responsibility हो, so we have to tell the teenagers to be their own partners for their own treatment. अगर you get them on their side, then they are more likely to follow what you want them to do. When do we avoid it? अगर बच्चे में cardiac symptoms हो तो. So if there is a heart issue, we do not give it. In the past, we never gave it when there was occurrence of tics, जो मैंने बताया था, because it seems to aggravate the tics. But अभी latest research shows that that is also not true, और tics में aggravation नहीं होता है. So even in a person with tics, आप दे सकते हो. I get a little nervous और मैं नहीं देता हूँ, frankly. What are the other uses? हम लोग दूसरे tablets भी use कर सकते हैं for the doctors who might be listening in. There are some antipsychotics, antidepressants, mood stabilizers. These are also things जो हम supervision के साथ दे सकते हैं. It makes a lot of difference. For the younger child, most medicines we try not to give, at least most of the stimulants and all, we try not to give below the age of 6 or 7. तो उसके पहले हम लोग क्या ट्राई कर सकते हैं? हम लोग occupational therapy ट्राई करते हैं. And there's something which is called sensory integration, जहाँ पे हमारे जो 5 senses है वो exercises देते हैं. Occupational therapists are professionals who have done a course in occupational therapy, and they teach children how to integrate their senses so that there's a calming down influence and concentration increase. So it's very, very effective in the younger child, may not be so effective in the older child. One more problem, learning disabilities. One second. What do we mean when we say learning disabilities? Now, this is very, very dear to my heart because about 15 to 20% of people, जो population को ये learning disabilities है. By learning disabilities, एक तो उनकी intelligence normal होनी चाहिए और almost normal होनी चाहिए. So अगर आपकी बुद्धि कम हो तो फिर आप learning disabled नहीं हो सकते. लेकिन मान लो कि आपको learning disability है, तो प्रकार की हो सकती है, अलग-अलग सी हो सकती है. Imagine कि you're very good in English, so you can talk Shakespeare, you can declaim plays and all, and then I give you maths, और आपको 2 times table में problem आ जाता है. You start saying this is from the same child. What is wrong with him? Or you're terrific in maths, so you can do logs and you can do calculus and you can do derivatives, and I ask you to read something and you make a hash. आपको spellings का problems होता है, you can't read properly, you stutter and you stumble and you say, what is wrong with this guy? He's at the 10th standard level in maths and at the 3rd standard level in English. Or you're very good orally. तो orally आप बहुत कुछ बोलते हैं, you ask them, you're discussing a composition, अब वो बहुत कुछ बोलता है, and he's the top of a class when he's in discussing mode and all of that, and you say अच्छा वही चीज आप अभी लिख के दो, and he gives you a written work and it's disgusting, it's terrible, you can hardly read it and it doesn't make sense. These are what we would call learning disabilities. This is very simplistic, लेकिन क्या होता है, हम लोग evaluate करते हैं और फिर अगर आपको पता चल गया कि the child is very good in terms of IQ or normal in terms of IQ, but in addition to that, he has difficulties in learning and in using academic skill, then that becomes an issue. And you start thinking, uski jo level hai, it should be appropriate. That causes a problem with academics, and then you start thinking that there is a problem, and you start ruling out things, and then you send for an evaluation, and that becomes in school age years. लेकिन कभी-कभी हम लोग देखते हैं only towards the end it becomes a major problem. So the parent will come in and say, but वो जब छोटा था तो वो बहुत कुछ करता था, वो बहुत अच्छी तरह से पढ़ाई करता था, अभी क्या हो गया? And then we say कि yes, it is a possibility. लेकिन normally 3rd, 4th, 5th standard में इतनी पढ़ाई नहीं होती है. By the time you come to the 8th and the 9th, it becomes a major issue. So उस हिसाब से the faculties that he needs to use are not adequate, and then that becomes a problem. Now, many years ago, I think it was in 1988. learning disabilities had come into India, and I was part of the first team which made a presentation to the governor of Maharashtra और अपने को concessions मिले for the 9th and the 10th at that time. अभी तो of course concessions are available from first standard all the way up to IIT. So it's a very, very major big thing, and we are very pleased with it because we must remember something. It's the easiest thing in the world कि हम लोग बोले अरे बच्चे में प्रॉब्लम है उसे स्कूल से निकाल दो. We're talking of 15% of the population, so that's a huge number of बच्चे जो है जो स्कूल में आप निकाल दोगे, लेकिन उनकी बुद्धि ठीक है. मान लो कि अगर कोई बच्चे की बुद्धि ठीक हो और आपने बोला कि आप नॉर्मल स्ट्रक्चर में नहीं आ सकते हो, तो फिर क्या होगा? बच्चे will use his intelligence in doing wrong things. So he'll end up doing things which we don't want him to. Rather than that, if you can manage to give him into the structured school environment, give him some kind of supervision, और अगर हम उनको supervise करें और channelize करें, then we are going to find that he's in a position जहाँ पे वो काफी कुछ कर पाएगा, and that should be good for him. The other thing is, as I said, he has to be of normal intelligence, so intellect में कोई problem नहीं होनी चाहिए. उसकी visual या auditory acuity में problem नहीं होना चाहिए. If he can't see properly, he can't hear properly, then we don't allow that to be a learning disability. उनको कोई neurological problem नहीं होनी चाहिए. कभी-कभी बच्चे जो है, they're very understimulated. If they're coming from a very poor family, जहाँ पे कोई stimulation ना हो, तो फिर वो normal जो reactions होनी चाहिए बच्चे को towards a particular thing, they don't occur, and we don't call that a learning disability. And they must have adequate education. थोड़ा बहुत अगर आपने education किया, उसके बाद ही हम diagnose कर सकते हैं कि उसको learning disability है. If he's never gone to school, then we would not be in a position to diagnose it. I've mentioned the various kinds, dyslexia जहाँ पे word का problem है, dyscalculia जहाँ पे math का problem है, dysgraphia जहाँ पे writing का problem हो. There's something called non-verbal learning disability, which is another thing. There's something जहाँ पे oral या written language disorder होता है, reading comprehension deficit होती है. And there's a very common one now which we are seeing जहाँ पे movements and coordination का भी problem होता है along with language and speech. So you throw a ball at him and he ऐसा कुछ करेगा, he won't be able to catch a ball. ऐसा सब कुछ हम लोग देखते हैं. So dyspraxia is also a very, very big thing that we are now seeing, and we should be aware. What does one do? First of all, अपने को awareness निकालनी चाहिए इसके बारे में. If I don't know about it, then I won't diagnose it, and I'll say ये बच्चा इस तरह से कर रहा है because he doesn't like me, he doesn't like the class. लेकिन ऐसा नहीं है. He's trying to do it. All kids want appreciation. वो try कर रहा है, लेकिन so often kids have come up to me and said, डॉक्टर अंकल मैं बहुत ट्राई करता हूँ लेकिन मैं क्या करूँ, सब लोग डांटते रहते हैं और मैं इतना ट्राई करता हूँ और मैंने देखता हूँ कि मेरे जो नेबरिंग डेस्क पे जो है वो 10 मिनट में सब कुछ करता है और मैं 1 घंटे की कोशिश करता हूँ, मेरे से नहीं होता है. देयर समथिंग रॉन्ग विद मी एंड आई सेड देयर इज नथिंग रॉन्ग विद यू, थोड़ा सा प्रॉब्लम है, हम देख लेंगे. सो इन एडिशन इनिशियली टू बीइंग अ साइकाइट्रिक और अ न्यूरोलॉजिकल प्रॉब्लम, उसके बाद साइकाइट्रिक इश्यूज आ जाते हैं, आपकी सेल्फ कॉन्फिडेंस कम हो जाती है, आपको अच्छा नहीं लगता है, देन यू स्टार्ट अवॉइडेंस बिहेवियर. अगर मैं मैथ्स ट्राई कर रहा हूँ और मैथ्स में नहीं कर पा रहा हूँ एंड एवरीबॉडी शाउटिंग एट मी फॉर मैथ्स, देन आई विल हेट मैथ्स, आई विल नेवर वांट टू डू इट. तो फिर वो फोबिया आ जाती है फॉर अ पर्टिकुलर सब्जेक्ट एंड दैट बिकम्स अ मेजर प्रॉब्लम. हम लोग क्या करते हैं, द ओनली वे आउट फॉर दिस इज लर्निंग डिसेबिलिटीज के लिए यू नीड अ रेमेडियल एजुकेटर. Remedial educator जो है, she has trained she's trained in remedial education. मतलब उनको सिखाया जाता है कि बच्चे लोग जिनको ये प्रॉब्लम होती है उसको किस प्रकार से टीच करें. We use a lot of aids, and fortunately, and we've pushed this through over and over and over again, all exam systems allow for concessions depending on the kind of learning disability that you have. एसएससी हो, सीबीएसई हो, आईबी हो, आईसीएसई हो, हर एक सिस्टम ऑफ एजुकेशन में there are lots and lots and lots of concessions that are made available, जिससे बच्चा जो है does not fall out of the educational pool. And sometimes parents come and say, उनको concessions क्यों दिया जाता है? Why should he get more time? Why should we not pay attention to his spellings? So he can manage without it. And I say, yes, he may. लेकिन मैं चश्मा पहनता हूँ. Will I manage without spectacles? Of course I will. But spectacles make it better for me. So why shouldn't I do something that makes it better? People ask me sometimes, learning disability है तो वो क्या करेगा, कुछ कर पाएगा क्या नहीं? Well, I'm very pleased to tell you कि हमारे जो hospital है, in one of my hospitals, the ex-head of, he's no longer alive, बट वो एक पीडियाट्रिक न्यूरोलॉजिस्ट थे और उनको सिवियर डिसकैल्कुलिया था, उनको मैथ्स का बहुत प्रॉब्लम था, बट ही बिकेम वन ऑफ द टॉप मोस्ट डॉक्टर्स। तो अगर आपने आपका माइंड किसी चीज पर रख दिया, आपको कंसेशंस दिए गए, आपको हेल्प दिया गया, आपको सपोर्ट दिया गया, एंड नाउ इट्स बिकम अ गवर्नमेंट रेजोल्यूशन, तो अगर स्कूल ने नहीं दिया तो द स्कूल कैन बी पुल्ड अप। So now even principals are becoming very, very nice and very supportive. अगर हम ये सब कर सके तो the sky is the limit. Let's get on to something which is fairly common now, OCD. अभी OCD बहुत common हो रहा है. When I was a medical student, हम लोग इतना नहीं देखते हैं, आजकल हम लोग बहुत ज्यादा देखते हैं. When I was a medical student, हम लोग 30, 35, 40 years के लोगों को देखते थे. आजकल हम लोग 6, 7, 8 साल के बच्चे को भी देखते हैं जिनको ये OCD है. It's not a nice thing. What is OCD actually? मेरे अंदर एक थॉट आ जाता है, जिसकी वजह से थॉट या आइडिया आ जाता है, जिसकी वजह से मुझे एंजाइटी बढ़ती है, मुझे घबराहट आ जाती है. सो एक थॉट आ जाता है कि मेरा हाथ गंदा है. ओके, ऑल ऑफ अस फील दैट समटाइम्स, एंड स्पेशली ड्यूरिंग कोविड तो बहुत ज्यादा हो जाता था. अगर मेरा हाथ गंदा है तो फिर कोविड आके मुझे कोविड मिल हो जाएगा. सो आई गेट दिस फीलिंग कि मेरा हाथ गंदा है, तो मैं हाथ धोने के लिए जाता हूँ एंड आई वॉश इट. और एक बार मैं धोता हूँ एंड आई फील गुड एंड आई वॉश इट अगेन एंड आई वॉश इट द थर्ड टाइम एंड आई वॉश इट द फोर्थ टाइम. और फिर मुझे पता चल जाता है कि अगर मैंने एक प्रकार से, एक तरीके से वॉश किया तो फिर और भी अच्छा लगता है. सो फर्स्ट आई विल ओनली वॉश माय दिस फिंगर्स, उसके बाद मैं पाम वॉश करूंगा, उसके बाद इधर तक वॉश करूंगा. एंड व्हेन आई फॉलो दिस रिचुअल व्हिच आई कॉल अ रिचुअल, तो मुझे बहुत अच्छा लगता है और मुझे बहुत अच्छा लगना है, तो फिर मैं बार बार ये करता रहता हूँ. सो वी हैव पीपल, फॉर एग्जांपल, इफ दे हैव दिस वॉशिंग रिचुअल, they wash for 1 hour, 2 hours, 5 hours, 10 hours a day. They go into the bathroom, they wash themselves. Bath ke baad, they will wash the taps, they will wash the soap, they come out. एक बार उन्होंने कपड़े पहन दिए तो फिर कपड़ा वॉशिंग मशीन में जाएगा. They lie on bed and I've had people when they wake up they say मैंने बेड को कंटामिनेट कर लिया, तो वो पानी लाके बिस्तर को धोते हैं. And it's reached a stage where they said कि अभी मैं बिस्तर को मैं बार बार कैसे धो सकता हूँ, तो मेरे पास अच्छा बेड है लेकिन मैं जमीन पे सोता हूँ, क्योंकि जब मैं जमीन पे सोता हूँ तो वो ब्लैंकेट उठा के मैं धो सकता हूँ. आई कांट कीप वॉशिंग द मैट्रेस. Learning disabilities OCDs has become very, very big. It's become a major issue and we are seeing a lot of it. It's very common also. Mean age of onset used to be 22, but we are finding it at younger age. Men and women here are equally affected. I've already said कि recurrent thought आता है या urge आता है या image आता है, जिसकी वजह से आपको anxiety होती है. आप उनको suppress करने की सोचते हो लेकिन वो होता नहीं है. You try to neutralize them with something else and then you start doing something and you do that over and over again, जिसको हम compulsion बोलते हैं. So the obsession is the thought and the compulsion is the action. All of us may be obsessive. अभी मैं जब मेरे क्लिनिक में जाता हूँ, I like my table to be neat and clean. So I like my pen in a particular place and my diary in a particular place. लेकिन अगर ऐसा नहीं हुआ तो I won't get anxious, I won't start crying, I won't get angry. If I start getting anxious and angry, then I have an OCD. I know my dad used to pack up clothes in a suitcase very well. तो वो शर्ट अच्छी तरह से करता था, वो पैंट अच्छी से. I don't have the patience for all of that. So he might have had obsessive traits. लेकिन वो मेरा सूटकेस देख के he would say hi तो क्या कर रहा है, but he wouldn't get angry, he wouldn't get upset. So there's a difference between traits which all of us seem to have and an actual disorder which becomes very distressing. Common ones are hand washing. You check things, you put things in order, it has to be in a particular way. You repeat words silently. They reduce your anxiety. I remember once मैं एक स्कूल में मुझे बुलाया गया था किसी बच्चे को देखने के लिए, and while I was just standing waiting for the kids, lunch break हो गया. So I was just standing in the corridor watching kids running in and out, and I saw some kid coming into a classroom and I was watching him. So he took 3 steps in front and 2 behind, 3 steps in front and 2 behind, 3 steps in front and 2 behind. Very obviously OCD. ये जो stepping है, वो जो counting है, वो जो बार बार करना है, that is all part of OCD, which we should be aware of. अपने को ये दिखना चाहिए, and then we should be able to treat it. So once again, this is a little bit of anatomy and all that, which we won't get into. क्या होता है इसमें? समटाइम्स इट इंक्रीजेस, समटाइम्स इट रिड्यूसेस। हम लोग एक प्रकार की थेरेपी यूज करते हैं जिसको हम CBT बोलते हैं, दैट सीम्स टू बी वेरी यूजफुल, बट समटाइम्स वी डू अ स्केल जिसको हम ये वाइबॉक्स स्केल बोलते हैं, द येल बाउंड ये द येल ब्राउन ओसी स्केल, जिससे अपने को सिवियरिटी पता चल जाती है, बिकॉज यू कुड बी माइल्ड, मॉडरेट, सिवियर, एंड डिपेंडिंग ऑन क्या होता है उस तरह से अपने को ट्रीटमेंट देना पड़ता है. व्हाट इज द ट्रीटमेंट? Number one is you have to recognize कि ये problem है. Lots of people don't even know they have it. They say, अरे वो is he does this, he does it on his own. कुछ कोई बात नहीं, क्या फर्क पड़ता है? but बहुत फर्क पड़ता है. One of the things we also do is कि अगर मुझे ये अभी इसी वक्त वापस करना है, I want to repeat the action, I will delay it. It's called response prevention. तो हम response को delay करते हैं. We have something else which is called a token economy, jahan pe we actually give rewards for doing what you're supposed to do and not doing what you're not supposed to do. So I want to normally spend 40 minutes in my bath jab main bath leta hu. So I will say, if you take 30 minutes, I will give you this token and then you can use it for something. After a week, I will make it 20 minutes. After a week, I will make it 10 minutes. So us hisab se you can manage to do things, because eventually the person knows कि मेरे जो विचार है वो they don't make sense, it's stupid, लेकिन मैं कंट्रोल नहीं कर पाता हूँ. One of the commonest things, by the way, that people also talk about is कि मेरे breathing पे मेरा बहुत ध्यान रहता है. वापस कोविड में everybody spoke of breathlessness. So लोग आते हैं और बोलते हैं कि when I go to sleep, I can't sleep because I keep focusing on my breathing, और मुझे लगता है कि मेरा ब्रीदिंग का प्रॉब्लम है, तो मैं रेस्पिरेटोलॉजिस्ट के पास जाता हूँ, मैं एक्सरे टेस्ट कराता हूँ, मैं MRI करता हूँ चेस्ट का, everything is clear, I do a pulmonary function test, that is fantastic. There is a problem with my breathing, and then we say no, there's a problem with your brain and not with your lungs. तो उस हिसाब से भी हम देखते हैं. Lots of tablets can be given for this. They have their own benefits depending on what the situation is. आजकल in very, very, very severe cases, we actually use psychosurgery, मतलब brain surgery होता है. And one of the things that they use is gamma knife. So gamma knife is a particular kind of, जैसे एक्सरेज होते हैं उसी प्रकार से गामा रेडिएशन होता है, और वो गामा रेडिएशन से काफी चेंजेस आ सकती है. यू कैन कट सर्टेन थिंग्स, जो लूप्स आते हैं जिसकी वजह से आप बार बार एक ही चीज करते रहते हो, उसमें प्रॉब्लम कम होती है. Let's talk of anxiety. We have time, no? Or you want to answer questions?
Sir, if we could take anxiety and depression, which is very, very common.
Good. So I'm taking anxiety.
We can just probably skip on the treatment and the scientific part of it, sir.
I've already done that most of the time.
Yes, sir. Yes,
yeah.
sir.
Yeah. So anxiety. One of the things we look at is something called a panic attack, जो बहुत लोग बात करते हैं उसके बारे में. So imagine कि आप कुछ कर रहे हो और suddenly आपको लगता है कि आपको हार्ट अटैक हो रहा है, आपके छाती में धड़ होता है, you start sweating, you start trembling, there's a shortness of breath, feelings of choking, आपको लगता है कि आप collapse होने वाले हैं, तो you are rushed to the hospital और आप बोलते हो मुझे हार्ट अटैक हुआ है, और the doctor checks you out, blood test करते हैं, and they find कि आपको कोई प्रॉब्लम नहीं है हार्ट में, आपको माइंड का प्रॉब्लम है, आपको ब्रेन का प्रॉब्लम है. इसको हम पैनिक डिसऑर्डर बोलते हैं, कि बहुत ज्यादा तकलीफ होती है और जिसकी वजह से you react in such a way कि आपको लगता है कि अटैक होगा. This happens quite often. और उसकी ट्रीटमेंट जो है, तो हम लोग तो बॉम्बे में, इंडिया में योगा करते हैं, that seems to help, but sometimes we have to use medication. उसके साथ साथ there is something called generalized anxiety, जहाँ पे बच्चा जो है या अडल्ट जो है is constantly anxious. तो उसको लगता है कि कुछ खराब होने वाला है, अगर मैंने ये किया तो ये होगा, अगर मैं बाहर गया तो मुझे ये प्रॉब्लम हो जाएगी, अगर मैंने ये नहीं किया तो वो आके मुझे मारेगा. This constant anxiety about the future, और ये anxiety जो है वो इतनी incapacitating हो जाती है कि it becomes a major issue. So this is something that we need to be aware of. So if you are looking at anxiety, we are looking at the fact कि घबराहट जो बहुत problematic होती है, और ये घबराहट की वजह से मेरी normal जिंदगी जो है उसमें प्रॉब्लम्स आती है. डिप्रेशन, द कॉमनेस्ट साइकोलॉजिकल डिसऑर्डर. सब लोगों को कभी कभी अच्छा नहीं लगता है, दे फील सैड, usually it passes away in a couple of days. अगर आपको ये डिप्रेशन का प्रॉब्लम है तो इट इंटरफियर्स विद योर डेली लाइफ, आपकी नॉर्मल फंक्शनिंग को प्रॉब्लम आ जाता है, एंड इट कॉजेस पेन बोथ फॉर द पर्सन एंड दोज हु केयर अबाउट इट. अगर रिलेटिव्स को डिप्रेशन है तो आपको भी ज्यादा पॉसिबिलिटी है कि डिप्रेशन हो. अगर फैमिली हिस्ट्री है तो ज्यादा है. फीमेल्स में ये ज्यादा है. इट सीम्स टू बी आल्सो हार्मोनली रिलेटेड. What causes it? Nobody really knows, but these are the symptoms. तो आपको डिप्रेस्ड मूड होता है, वो सेटिस्फैक्शन जो होना चाहिए चीज करने में उसमें कोई मजा नहीं आता है आजकल. आपकी वेट लॉस हो जाती है. वेरी ऑफन यू लूज अ लॉट ऑफ वेट व्हाइल यू आर नॉट डाइटिंग, एंड दिस वी आर सीइंग अ लॉट ऑफ. बच्चा आता है और बोलता है कि मैं अच्छी तरह से डाइट करता हूँ लेकिन अच्छा नहीं लग रहा है और मेरा जो वेट है वो कम होते जा रहा है. स्लीप डिस्टर्बेंसेस होती है, रिटार्डेशन ऑफ एक्शन होता है, कुछ करने का मन नहीं करता है, आपको फटीग होती है, लॉस ऑफ एनर्जी. एंड दिस इज द मोस्ट इंपॉर्टेंट एंड द मोस्ट फ्राइटनिंग थिंग जो हम बोलते हैं वर्थलेसनेस, हेल्पलेसनेस एंड गिल्ट. तो मुझे लगता है कि आई एम अ वर्थलेस पर्सन, मुझे लगता है कि मैं कुछ नहीं कर पाऊंगा, और मुझे लगता है कि मुझे बहुत गिल्टी लगता है बिकॉज ऑफ द वे आई एम बिहेविंग. इट्स गोइंग टू अफेक्ट एवरीबडी. और उससे क्या होता है कि हमारी जो कंसंट्रेशन की एबिलिटी है वो कम हो जाती है. सो स्पेशली इन द यंग किड, आई हैव ऑलरेडी स्पोकन अबाउट द फैक्ट कि बच्चे में डिप्रेशन इज मे बी जस्ट फिजिकल, हेडेक, बॉडी एक एक्सेट्रा, और उसके साथ साथ कंसंट्रेशन कम हो जाता है, एंड दैट बिकम्स अ प्रॉब्लम. एंड देन द फ्राइटनिंग थिंग इज यू स्टार्ट थिंकिंग अबाउट डेथ. व्हाट इज द पर्पस ऑफ स्टेइंग अलाइव? क्या मुझे मरना चाहिए? अगर मैं मर गया, मैंने खुद का लाइफ लिया, तो लोग थोड़े टाइम के लिए they'll get upset, but उसके बाद they'll get back to the life of living, etc., etc. Ladies में there is more sadness, there is more worthlessness, more attempts at suicide. Men में there is more fatigue, there is more irritability, there are sleep disturbances, but they are more likely to turn to alcohol and drugs. तो ये हम अंतर देखते हैं boys and girls में. Treatment is basically medication. I won't talk of oppositional defiant, but I'm going to come to suicide because Madam had spoken about it right in the beginning, and we are seeing too much of this now. This is one of the most frightening things. Many years ago, मुझे याद है कि midday के cover में there was this little girl, must have been in the 8th or 9th, she must have been about 8 or 9 years old, and she was on the cover, and she had a cello. Cello एक musical instrument होता है, it's like a violin. तो क्या होता था, she was on the cover of this, and because of that she was in a situation where their newspaper had said that she had tried to commit suicide, 8 or 9 years old, and they had taken a kind of a history, and they came to the conclusion कि बच्ची जो थी उस टाइम पे there were these TV shows going on, live shows, you know, and she used to learn Bharatanatyam or something. She wanted to get onto one of the dance shows. तो उनके पेरेंट्स ने कहा था कि तू बहुत छोटी है, 1-2 साल के बाद ऐसा कर. उसको बुरा लगा. She went down. She was playing with her friends, and there was a 12-year-old kid who she was playing with. Said, अरे तू एक चीज कर यार, तू किचन में जा, उसके बेसिन के नीचे there will be something, तू वो ले लेना, and parents will get scared and they'll let you do what you want. She did that and she landed up in hospital. अभी ये जो है suicide, unfortunately आजकल हम लोग बहुत ज्यादा देखते हैं. So for the teachers and for the parents, look out for these signs. These are the most important things that we look at. Number one, a person is constantly thinking about suicide, making comments about being hopeless, helpless, or worthless. This is again something that we see. Saying things like, "Acha rehta if I were no more," or "What is the point of staying alive?" When you call up people to say goodbye, that is again something you start wondering, ye kyun hai? You're having a death wish. Adolescents may, a lot of kids, they, you say कि ये लोग show off कर रहे हैं. So he drives very fast, or he doesn't wait for a traffic signal, या he climbs up where he shouldn't climb up, and things like that. कभी-कभी हम लोग history लेते हैं उनके, and then we come to the conclusion that they are hoping that they die. So this is something that we should be aware of. there's a lack of hope for the future, or feeling that things will never improve. And recently, agar kisi mein death hua ho, if a parent has died, even if animals die, if their pets die, we've had kids who attempted suicide because they just couldn't bear the thought ke unki jo 14 saal ki jo dog thi wo guzar gayi suddenly, and after 6 months they attempted suicide because they just can't bear with the loss. Previous suicide attempt, this is again something very recently I had dealt with a 14-year-old kid, and she has attempted it thrice already. So normally क्या होता है कि research has shown कि अगर आपने आज try किया तो in the next 6 months the possibility is about 40% कि आप वापस try करोगे. So we must try to prevent that from happening. And if there's a history of suicide or attempted suicide in a close relative, then the chances are more. Alcohol abuse, drug abuse, that is again something which is a big thing. अगर आपको alcohol abuse हो या drug abuse हो, they have a greater than normal incidence of attempting suicide, especially in adolescents. Suicide notes. I've seen suicide notes which are very frightening. और जब आप देखते हो कि 16 साल की बच्ची ने ऐसा कुछ लिखा है तो आपको लगता है कि life must be really bad. And sometimes, surprisingly, they're very cheerful. So they've been very quiet and very down, and then you treat them and they become very cheerful, and you start wondering, वाह क्या अच्छा हुआ है. But it might just be कि उन्होंने decide किया है कि मुझे अभी मानना ही है, and that makes them happy. Teens may they talk of boredom. So when we do a psychological autopsy, which means that उन्होंने try किया and then they're safe, they come into hospital, we go to them and they say आपने क्यों किया? And they say मैं bore हो गया. अभी boredom, one doesn't think that you're going to kill yourself, but ये भी होता है. If they say things like I will not bother you anymore, and they do not respond as before. आजकल homosexuality and bisexuality बहुत ज़्यादा हो रहा है. People like these have a higher thought of suicide and higher attempts in the past year rather than those who have had heterosexual experiences, especially because acceptance अभी तक अच्छी इतनी नहीं है. We must realize that teen suicide warning signs are serious calls. और अगर आपने, if they try to share themselves, our reaction should not be, how can you think like this? What is wrong with you? आप इतने अच्छे family में आते हो. How can you think of suicide? दूसरे लोग क्या कहेंगे? That is stupid. We have to listen to them and attempt and acknowledge their feelings and try to help them with medication and with other things as well. There is no physical abuse. What do parents, should parents or teachers do? There should be absolutely no physical abuse. That's important. You should be a good role model. अगर आप पूरे time smoke करते रहे and then you tell your son आपको smoke नहीं करना है, then that is stupid. You give consequences of behavior. मतलब अगर आपने ये किया है तो ये consequence होगा. कभी-कभी आपको respond नहीं करना है. कभी-कभी क्या होता है कि अगर हमने respond किया तो फिर मामला जो है वो बिगड़ जाता है. So you get into this, how can he say that I'm the older person? अरे ठीक है, it's all right. We all have bad days at times. It doesn't matter. We need to give a lot of attention, and the attention should not be only of studying. I do this every year. कभी-कभी मैं जब मैं ये webinars करता हूँ, then I tell parents, think of the last 10 times जब आपने अपने बच्चों के साथ बातचीत की, और वो last 10 times में मुझे बताइए कि स्टडीज के बारे में, एग्जाम्स के बारे में, ट्यूशन के बारे में, होमवर्क के बारे में, वो सब निकाल दो. बाकी किस चीज के बाद आप लोग करते हो? इससे भी कुछ और बात ही नहीं होती. And that's terrible for our children if they feel that the only importance in their lives is studying and homework, and this life is very bad for them. Medication अगर देना है तो देना है. Let's not our biases come in the way. The earlier the child is diagnosed, the faster the treatment can be started, the more effective it is. So this is very, very important. And I don't know how many of you look at Dr. Google. Dr. Google is not a doctor. Please remember, he's about 15 or 16 years old. उसके पहले तो वो जिंदा ही नहीं थे. हम लोग जिंदा थे. हमारे पास आओ, Dr. Google doctor नहीं है. I think I should stop here, Dr. Rachana, and then you answer me the questions.
Sir, it has really been a wonderful session. And I should say, most importantly, the last part that you covered on suicide, because it is an alarming number of cases that we are seeing. And somewhere or the other, we keep hearing that a child has, lost life to suicide. And I mean, as you rightly said, it is so frightening to even think that a child or a teenager finds life not worth living, rather when their life is supposed to be the most exciting, or I could say the most happiest of them all, but still they find the life not worth living. So basically what I would just like to say is that parents, especially mothers, they are excellent. We say they have sixth sense. They are James Bond, basically. They know how to smell a problem on their child from far away. So the only thing that I would like to tell the family, the mother, that one is, do not have disputes amongst yourselves. If anybody is finding a problem, do not disregard it. Let your senses always be on high alert for these children. If you find any behavioral changes which are consistent, which are disturbing, please discuss it in the family and seek help from a psychologist or a psychiatrist or a counselor. I mean, mental health issues are not something to be ashamed of. Rather, there is now so much of awareness which is coming up that you can discuss it very freely, very openly, and there is no stigma associated with it at all. That is what I would like to say. And children these days, unfortunately, they can't take a lot of things, because we are giving such a protective kind of parenting. We remember in our days, parents used to just leave us, and we used to fight our own battles our own ways. So probably we were more resilient. But now if you see, children can't take refusals, they can't take failures, they cannot handle broken relationships, they cannot handle stresses, they cannot handle studies. So if anything is there, please consult somebody who deals in these problems, rather than, as sir rightly said, going to the Google doctor, or going to just somebody who is not a doctor, discussing with your family, who has no relation whatsoever to psychiatry or counseling, or just considering that it's a phase and it will pass off, and then repenting it later. So sir, it is a wonderful insight you have given into all the mental health issues that we see in children and adolescent age. I'm just going to be taking up a few questions which have come in the chat box. So one child has asked, I am not able to concentrate on my studies. What should I do?
Okay, so probably the most important thing is that you should have yourself evaluated by a mental health professional, because there could be a lot of reasons. One of the things we look at is attention deficit. Another thing we look at is maybe the possibility of a something else which exists with it. Very often, if there's a lot of anxiety and depression, then that prevents you from studying the way you should. So what you need to do, rather than just fumble around, is to go find somebody like me and get a proper evaluation done wherever you are, in whichever state you are. Because getting a proper evaluation done, then you'll know the options that are available for treatment.
Great. And it's not that every time you visit a psychiatrist, you will always be prescribed only medicines. There are times when only counseling works. Yeah. And that is what talking, what the children cannot talk to you. Probably they find a better outlet when they talk to the psychiatrist and the counselors, and they're able to vent out their feelings, and probably, just relieving themselves of that emotional burden. Probably that will make them, make it easier for them to open up and start living their life as normally as they can. So the next question is, if ADHD remains undetected and untreated in adolescent age, how does it manifest in adults, and can it be treated then?
Okay. It can be treated in adulthood. There are certain different ways of treating it. There used to be this whole thing of that if you were not treated adequately in childhood, then it became an adult ADHD thing. But we are seeing signs and symptoms of adult ADHD by itself. We do see that happen. We see that happen quite a bit. Treatment is more or less the same medication, but of course it's given in a slightly different, it's given in a different dose. And there are more behavioral issues and behavioral modification techniques that you can use in children. You don't use so much in adults. What seems to help in both to some extent is physical activity. Certainly it's not a solution. I mean, if you came to me and you said you had attention deficit disorder, I won't say just do exercise and all will be well. That is being stupid, but it's known to help. So one of the things that is known to help is being structured in your routine, doing a lot of physical activity, eating properly, trying to avoid too much of sugar, because that seems to trigger off, in some susceptible kids, it seems to trigger off a little more restlessness. Following the behavioral techniques that a behavioral therapist will be able to do, and doing medication where it is necessary. And getting the support of the school if you're in school, and getting the support of your spouse if you're married.
So, sir, the next question which has come is, if your child is finding studies very difficult, then would you say that they need to be evaluated? If it is a consistently, either a consistent not being able to pick up the studies, not able to understand subjects, or failures, or rather performing poorly in the scholastic areas, or second, if the performance was better and now it has dropped down to a considerable extent. So in these situations, would you say that consulting a psychiatrist or a mental health professional would be more advisable?
I would certainly say so. If there is a change from the past, जहां आप पहले पढ़ाई कर सकते थे बराबर, और फिर अभी आपका कंसंट्रेशन जो है वो कम हो गया, या फिर आपको लगता है कि आप बहुत ज्यादा एफर्ट कर रहे हो और फिर भी आपकी जो रिजल्ट्स है वो इतनी अच्छी नहीं है, then it's a good idea to seek an evaluation. See, what happens also is, we must remember something. Out of every 100 patients who come to me, about 20 or 30 I will say कि आपको मेरी जरूरत नहीं है. But if वो 70 या 80 जो हमारे पास आते हैं, and we can start treatment immediately, then they do very well. So even if you're not absolutely certain कि आपको कोई problem है, but you feel कि शायद है, get yourself evaluated. ऐसा कोई problem तो नहीं होने वाला. और ये जो स्टिग्मेटाइजेशन है, वो स्टिग्मेटाइजेशन अभी हमें निकलना है अपने दिमाग से. अगर आपको पेट का प्रॉब्लम हो तो आप गैस्ट्रोएंटरोलॉजिस्ट के पास जाएंगे, अगर आपका हेडेक है तो आप न्यूरोलॉजिस्ट के पास जाएंगे, आपके आंख की तपास करेंगे. उसी तरह से अगर आपको ये सब प्रॉब्लम्स है, हमारे पास आ जाइए. Nobody is going to look at you and say, हाय पागल है. मेरे पास कोई पागल आता ही नहीं.
एब्सोल्युटली एब्सोल्युटली सर, ये साइकियाट्रिस्ट और पागल, ये जो एसोसिएशन करके रखा हुआ है, वो कहीं तो पहले निकालने की बहुत ज्यादा जरूरत है.
बहुत ज्यादा, बट वही निकल रहा है. आई थिंक
निकल रहा है. पीपल आर बिकमिंग मच मोर अवेयर. एब्सोल्युटली.
मच मोर अवेयर.
सर, आपने जो ये 20-30% लोगों का बोला कि जिनको मेरी जरूरत नहीं है, आप शायद वो बताना चाह रहे हैं कि उनकी स्कोलास्टिक कैपेबिलिटीज थोड़ी कम है. सो अगर पेरेंट्स को सिर्फ ये बता दे कि अगर स्कोलास्टिक कैपेबिलिटीज कम है तो हर एक बच्चा आइंस्टाइन नहीं बन सकता. सो अगर आप ये थोड़ा सा स्ट्रेस कर दे तो बेटर होगा.
जरूर. सो इफ यू आर लुकिंग एट इट इन टर्म्स ऑफ कैपेसिटी, कैपेसिटी का मतलब हुआ कि आपकी जो इंटेलिजेंस है, बुद्धि जो है. नाउ बुद्धि प्रकार प्रकार की होती है. हर एक बच्चा जो है वो मैथ्स नहीं कर पाएगा. हर एक आदमी जो है वो, उसको कंप्यूटर्स समझ में नहीं आएगा. बहुत लोग हैं जो बायोलॉजी एक्सेप्ट करते हैं. अगर मैं हिंदी में बात नहीं कर सकता, मराठी में बात नहीं कर सकता, इसमें मतलब, इसका ये मतलब नहीं हुआ कि मेरी बुद्धि नहीं है. सो एवरीबडी हैज डिफरेंट वेज एंड डिफरेंट एसेट्स इन देम. हमारी ड्यूटी होती है एज अडल्ट्स कि हम उनकी जो पॉजिटिव्स हो उस पर हम ज्यादा ध्यान दें, और उनकी जो नेगेटिव्स हैं उसको हम जितना कम हो सके वो कम करने की कोशिश करें, so that they learn how to cope with it, and at the same time they do whatever they can to actualize their potential. मतलब वो जो कर सकते हैं, जितना वो कर सके, हम उनको सपोर्ट दें. Like madam said quite correctly, हर एक आदमी डॉक्टर नहीं बन सकता है, हर एक आदमी इंजीनियर नहीं बन सकता है, and everybody has their own role in life. So let us try to support that.
Absolutely. So
अच्छा, दूसरी बात है, one more thing. There is no medicine to increase intelligence. जो बुद्धि हमें दी गई है उसको हम बढ़ावा नहीं दे सकते. लेकिन अगर कंसंट्रेशन का प्रॉब्लम है, कंसंट्रेशन को बढ़ावा दे सकते हैं. अगर लर्निंग डिसेबिलिटी है, उसका हम ट्रीटमेंट कर सकते हैं. अगर घबराहट हो जिसकी वजह से हमारी जो बुद्धि है वो इट्स नॉट बीइंग यूज्ड इन द फुल फॉर्म, वो घबराहट को हम कंट्रोल कर सकते हैं. बुद्धि बाय इटसेल्फ हम कुछ नहीं कर सकते. नहीं तो हम सब लोग दवाई लेते हैं जिससे हमारी बुद्धि बढ़े.
Absolutely. So किसी भोंदू बाबा के चक्कर में मत पड़िए. So intelligence is what you are born with probably. उसे हम जरूर बढ़ाने की कोशिश कर सकते हैं, लेकिन ये बात जरूर तय है कि सब में अपनी अपनी एक खूबी होती है. So अगर हमारे में थोड़ी खूबी थी शायद पढ़ाई करने की, हम डॉक्टर्स बन गए. शायद हमारे में से किसी लोगों की कुछ खूबियां हैं कि जैसे लता मंगेशकर जी को ले लीजिए कि उनमें खूबी थी गाना गाने की, तो वो शी बिकेम लाइक द वॉइस ऑफ इंडिया. वैसे हर एक जन में अपनी अपनी खूबी है. वो खूबी खूबियों को निहारिए, वो खूबियों को भी आप बढ़ावा देंगे तो इतने सारे प्रोफेशंस या इतनी सारी चीजें रास्ता खुल जाएंगे कि आपको हर चीज, हर रास्ता पढ़ाई को होकर ही जाता है। अनफॉर्चुनेटली अपने इंडिया में कैसा है कि एवरीथिंग इज रिलेटेड टू द एग्जाम सिस्टम एंड विच इज अ मार्क्स बेस्ड सिस्टम। हम हर एक बच्चे को अपने बाजू वाले के बच्चे से या क्लास में जो टॉप कर रहे हैं वो बच्चे के साथ कंपेयर करना जब छोड़ देंगे, क्योंकि मैंने ये देखा है कि 5th और 6th स्टैंडर्ड के बच्चों को, उनको ओलंपियाड्स में कितने मार्क्स आते हैं, फर्स्ट रैंक में आते हैं कि नहीं, सेकंड रैंक पे आते नहीं, उसके लिए क्लासेस लगाए जाते हैं फर्स्ट सेकंड रैंक के लिए ओलंपियाड्स में, उसमें बच्चों को स्ट्रेस दिया जाता है। बच्चों को खेलने के लिए, बच्चों को अपनी फ्रीडम एक्सप्रेस करने के लिए हम पेरेंट्स ही वक्त नहीं देते। हम अपनी जो इच्छाएं हैं, अपने जो एस्पिरेशंस हैं, वो हम बच्चों के ऊपर इतना ज्यादा लाद देते हैं कि हम बच्चों का बचपन उनसे निकाल लेते हैं। सो इट्स अ सिंसियर रिक्वेस्ट टू ऑल द पेरेंट्स दैट डू नॉट बी इन द रैट रेस। यस, इट इज अ कॉम्पिटिटिव वर्ल्ड, लेकिन बच्चों को भी थोड़ी अपनी जिंदगी जीने दीजिए। और जैसे सर ने सही कहा, बच्चों को एक फिजिकल आउटलेट होना भी बहुत जरूरी है। उनको थोड़ा सा गेम्स या थोड़ा सा स्पोर्ट्स, जो पढ़ाई लिखाई है उससे बाहर भी उनको कहीं ना कहीं अपनी एनर्जी निकालने का एक तरीका दीजिए। इट विल बी वेरी वेरी हेल्पफुल। सर, वन a quick I would ask you to summarize please, what symptoms should parents be watchful for in children if they think in terms that something is wrong with my child and I need to seek help? So what all symptoms would be like triggering some alarms in the parents?
Okay. So it all depends on the age of the child, but I'll just give you a general overview, which I said right in the beginning. If you're looking at academics, academics में, if you feel the person is his milestones were normal, मतलब उसका जो जब उसने शुरुआत की थी तो किस उम्र में वो चलना उसने शुरू किया, किस उम्र में उसने वर्ड्स पापा मामा बोलना शुरू किया, उसके बाद वर्ड्स के सेंटेंसेस हुए, उसका आई कांटेक्ट बराबर है या नहीं, वो एक ही चीज रिपीट करता है या नहीं, उसको चंचलता है या नहीं बहुत ज्यादा, अगर वो बैठ सकता है, अगर दूसरे के साथ इंटरेक्ट कर सकता है, अगर उसके बहुत टेम्पर टैंट्रम्स है, अगर वो बहुत इरिटेटेड होता है, दैट इज फॉर यंगर चिल्ड्रन। अगर वो बहुत डरता है, टू मच ऑफ फियर इज ऑल्सो नॉट कंसिडर्ड नॉर्मल। एज यू ग्रो अ लिटिल ओल्डर, अगर वो उसकी पढ़ाई का क्या प्रॉब्लम है, अगर वो लिख सकता है, अगर टीचर जो लिखती है वो कॉपी कर सकता है, if he is managing to stay within time limits, खाने का प्रॉब्लम, सोने का प्रॉब्लम, elimination का प्रॉब्लम, मतलब he is not constipated, he doesn't have loose motions when he gets nervous and angry। फिर अगर उसके body symptoms हो, headache, body ache, that I have said, that is one of the most important things। अगर वो बहुत किसी चीज से बहुत डरता है, अगर किसी चीज से बहुत फोबिक है, so I don't want to go to that person, I don't want to go to his house, etc etc, क्योंकि आजकल sexual abuse भी बहुत हो रहा है, physical abuse भी बहुत हो रहा है, we are seeing it in our children, so we must trust our children। अगर उसने बोला कि वो मुझे अंकल के पास या आंटी के पास नहीं जाना है, और आप gently attempt to find out कि किस चीज की वजह से ये हो रहा है, rather than saying अरे he's such a nice man, how can you talk like this। As you grow slightly older, when you come to the 10th 11th 12th 13th, आपके रिलेशनशिप शुरू होते हैं। जब रिलेशनशिप शुरू होते हैं, then you get into this whole thing of मेरे पास कोई बॉयफ्रेंड नहीं है, मेरे पास कोई गर्लफ्रेंड नहीं है, या वो मुझे देखती है या वो मुझे देखता है, and I don't like this and I don't like that and all of that। तो relationships के बारे में we have to teach our children। It's very very important। Let us realize कि जो sexual activity होती है happens with everybody and we must be aware of it। As we come to a slightly higher older person, then we start thinking also in terms of things like depression, things like एंजाइटी, जो घबराहट होती है या डिप्रेशन लगता है, कुछ करने का मन नहीं करता है, कुछ अच्छा नहीं लगता है, sometimes there's no motivation to do anything, especially if you see a person used to be very good, मतलब वो बहुत कुछ करता था and suddenly he stops doing anything, या it takes very long for him to do things, then we start thinking कि अगर उसके दिमाग में कुछ है जिसकी वजह से वो नहीं कर पा रहा है, is it because he's depressed or anxious or is there something else। Getting very angry, अगर मुझे बहुत ज्यादा गुस्सा आ रहा है और बहुत ज्यादा गुस्से की वजह से मेरे रिलेशनशिप स्पॉइल हो जाते हैं। इफ आई गेट इनटू फिजिकल स्टफ, मैं खुद को मारता हूँ, किसी और को मारता हूँ, दैट बिकम्स अ प्रॉब्लम। लर्निंग डिसेबिलिटीज के बारे में मैंने ऑलरेडी बात की है, अटेंशन डेफिसिट के बारे में बात की है। इफ यू गेट वेरी ऑपोजिशनल, अगर मुझे लगे कि जो भी है everybody is against me, everybody is after me, I'm going to get angry with everybody, then that is again something that we should try not to look at। if we get into a situation also जहाँ पे बहुत ज़्यादा lassitude या lethargy हो, जहाँ मैं पूरा time सोता रहता हूँ, पूरा time मुझे negative विचार आते हैं, I don't feel like getting up because अगर मैं उठ गया तो फिर I'll have to face the bad world, and that is again something we look at. Addictions is something very big. अगर addictions शुरू हो गए तो you certainly have to bring your child to the doctor. Eating disorders, अगर आपका बच्चा जो है वो बराबर खाना नहीं खा रहा है या keep saying कि मुझे नहीं खाना है, I'm putting on weight, and you look at him and you find that he's very thin, because eating disorders again has become a very big thing. नींद के problems है, that is again something that we look at a lot. So this whole spectrum of things, and if you find a change from the past, plus if you feel that the person is looking very sad and he's talking of not wanting to go to school, then you try to find out what is happening. Bullying has become a very big thing, both online and in actual person. हमारे टाइम पे तो साइबर बुलिंग होती नहीं थी, आजकल साइबर बुलिंग बहुत ज्यादा हो जाती है. So that is again something we have to look at. So these are the various things. अगर आपको लगे कि इसकी वजह से आपके बच्चे पे बहुत बुरा असर हो रहा है, या बहुत बढ़ रहा है, या कंटिन्यूअस है, या the teachers are complaining about it or other kids are complaining, then it is a good idea to go and see a doctor.
Sir, again a quick this thing from you. If the parent finds that the child is talking consistently negatively, talking sometimes dropping hints of departing or committing suicide, or in some way or the other they're talking negative about life, what would be your suggestion to the parent? Because the parents need to be vigilant.
Yeah, so I would say be on the side of caution and please take your child and get an evaluation. It doesn't matter, let 100 kids be evaluated by a doctor who will say कि कुछ problem नहीं है, but if you catch that one kid, you save a life. And especially if a person is talking about the end of life, we take it very seriously. You know, when we were youngsters ourselves in medical college, हम लोग ये बोलते थे कि when a person talks about suicide, he's not going to do it because जो भोगता है वो करता नहीं है, kind of thing. आजकल जो हम बोलते हैं कि if a person talks about it, he will do it, or he's very likely to do it. So we must take it very, very, very serious.
Absolutely. And still they have to be on the suicide watch, even if you are taking them to a psychiatrist. You have to be with them. You are not supposed to be leaving them alone. I think sir will be in a better position to give a bit of
So let me tell you about suicide watch. Especially if a person has tried it once or there's a family history of it, then we tell the person all medicines to be under lock and key. Sharps to be taken, मतलब जो sharp objects होते हैं, you try to restrict it to the utmost. If you're in a place where there are grills, that's better, but if they're not, then I mean, I've had people who put grills into their house because they say, okay, we cannot take a chance. Especially initially, जब आप bathroom में जाते हो, try to ensure that the door is not locked. थोड़ी बहुत privacy तो देना जरूरी है, लेकिन फिर भी आप regularly tell them that I'm very worried and I know you're going to feel that I'm overdoing it. लेकिन थोड़े time के लिए please bear with me and please answer me when I say सब ठीक है क्या अंदर, because they will get irritated and say, I've told you no, I'm okay. Can't I even be in the bathroom in peace? But this is something that we do. If the person is in a boarding, because sometimes this also happens in boarding schools, then the teachers have to take a little more precaution. The principal has to be aware of what is happening. You absolutely have to give, you have to tell people about it who are in positions of power, which means you have to tell the principal, you have to tell other people who are in charge. You should not take, I mean, a parent, of course, has to take control. But if you're a teacher, do not take full responsibility for this. Everybody is part of the whole game to get things under control. So that is very, very, very important. Sometimes, especially when you're a young doctor or a young counselor, you say, "Main sab kuch kar lunga." Don't have somebody supervise you, have somebody with you, because all said and done, it is necessary also to, shall we say, not take full responsibility for what might happen.
So parents, please be vigilant. The suicide rates are increasing and it's a very, very real thing because there is no turning back after that. So please be very, very, very watchful. Sir, whom to consult for a child's behavioral issue, a psychologist or a psychiatrist? A very basic question.
Well, I'd always say that you go to a psychiatrist initially, because the psychiatrist would be in a position, like I said, most of us would, if we feel that there is nothing really that for which they need
Absolutely.
intervention, we would send to a psychologist. You must remember that we've done basic medicine. So brain structures and all, we probably know much, much more
Yes.
than the psychologist. So it's always better.
Absolutely. And so probably the last question is how to handle anxious child at home who is already on pharmacotherapy and psychological counseling.
Yeah. So thank you for sharing this question. I saw it some time ago, and I think it's a wonderful question. We must remember something, whether we like it or not, about 20% of our population will be needing some kind of intervention by a psychiatrist or a psychologist, because they will have had some signs and symptoms which are enough to make them seek help. So if you've sought help and the person is already on pharmacology and is doing therapy, then all you need to do at home is to be supportive. Do not treat him very specially, which means don't pussyfoot around him, don't jump around him saying, hi, hi, agar kuch bol diya, to फिर कोई problem हो जाएगा कि क्या है, ये क्या है. Let's not make it, make him absolutely feel कि क्या हो रहा है सबको, everybody's treating me so differently, etc., because that is also not necessary. But give him some support and give him concessions. I mean, everybody has bad days. So we have bad days at times where we like people to be supportive of us. So if he has a bad day, accept it. The other thing that I tell people is sometimes, when a child gets angry, we get angry because we say, "Arey, wo to chota hai, hum bade hain. How dare you talk to me like that? Kya samajhta hai apne aap ko?" So I tell them that kabhi-kabhi getting angry is a sign of depression. So when you're depressed, आप चुप भी बैठ सकते हो, और कभी-कभी जब आप डिप्रेस्ड होते हो तो आप यू गेट वेरी एंग्री आउटसाइड एंड यू बर्स्ट आउटसाइड. और ये जो बर्स्टिंग आउटसाइड जो होता है, if we start shouting at them and saying क्या समझते हैं अपने आप को, फैमिली का तू क्या है, तू छोटा है, मैं बड़ा हूँ, etc., all that is unnecessary. The child needs to feel that he is acceptable, he is accepted, that he has ideas which may not always be the best in the world. But because I have a bad idea doesn't mean it's a wrong idea and doesn't mean I'm a bad person. So even in our communication, हमारी जो communication होती है, we should not say you're a bad person. We should say what you're doing is stupid.
Absolutely.
We should not say I don't like you. You should say I don't like what you're doing. So separate the person from the action. That is the most important thing going. Kabhi-kabhi adults come up to me and then we are talking about the past. They say, my mommy always used to tell me she doesn't like me. And then I would say, maybe she didn't like what you did. She would probably die for you because most parents die for their kids. But कभी-कभी हमारी communication में हम लोग इस तरह से बात करते हैं कि बच्चे को लगता है कि मैं अच्छा आदमी नहीं, या I'm unwanted.
Absolutely. So parents in a fit of anger, we speak certain words, certain gestures which children are in no position to understand that they are spoken in a fit of rage or a fit of frustration. They take it literally, actually, they take only your words for them. Actually, whether they realize or they don't realize, you are their whole world. So your words are going to make a hell of a difference in their lives. And I remember, I have a child, whose mother once said that, during a photo shoot that you're not smiling properly. And that child now in any of the photo shoots does not give a smile. So, it's like the child has grown also, but that thought process still continues. So each and everything that you say is going to have an effect on the child. So please be very, very watchful. And as sir rightly said, hate the action of the child and not the child. Never say I hate you, or whatever is wrong with you. I mean, I don't like you as a parent. So with this, I think we can come to a closure of this session. There are certain questions on screen addiction. I think if you go to our YouTube channel, with the name of Teen Talk for Better Tomorrow. That is the name of the YouTube channel, Teen Talk for Better Tomorrow. You will find many sessions which we have conducted in the past, and one of them deals with the screen addiction in children, and that will definitely give you a better insight into how to deal with screen addiction in children. We have also received बहुत सारे suggestions आए हैं regarding positive health and parenting. Sir, there's a question about stuttering. Would you just want to quickly say what is it a sign of? What is stuttering? What is it a sign of?
Okay, so stuttering जो होता है could be related to two things. एक तो there could be a physical problem. तो जो physical problem रहता है उसकी वजह से there is something wrong in the vocal cords and things like that, the muscles of the throat, and that ENT person has to check and say that it's okay. but that is a very small percentage. ज्यादा करके जो स्टटरिंग होती है, that is related to a lot of psychological issues. जब घबराहट होती है तो स्टटरिंग होता है. कभी कभी लोग बोलते हैं कि आई ओनली स्टटर एट अ पर्टिकुलर सिलेबल, मतलब एस पे स्टटर करता हूँ, पी पे स्टटर करता हूँ. सम पीपल से कि मैं स्टटरिंग उसी टाइम पे होता है व्हेन आई एम टॉकिंग ऑन द फोन. सम पीपल दे से स्टटरिंग उसी टाइम पे होता है व्हेन आई हैव गॉट नंबर्स टू टॉक अबाउट. सो यू नीड अ प्रॉपर इवैल्यूएशन. अगर घबराहट है, अगर डिप्रेशन है, तो उसका ट्रीटमेंट करो एंड समटाइम्स स्टटरिंग स्टॉप्स. Otherwise, there are behavioral issues. We use what is called a metronome. A metronome is like a machine. जहाँ पे आप टक 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 जो होता है, it's like a little bar with a thing. And you don't even have to do that. What you can even do is just use your finger and keep tapping. Normally, जब stuttering होता है, बच्चा जो है या adult जो है, वो बहुत fast होता है, जैसे मैं बोल रहा हूँ. So, if I talk very fast and I want to stop myself from stuttering, then what we do is we learn how to talk slowly. So, tuck, tuck, tuck. So, I will do tuck, tuck in front of him and I will say, now you say your sentence. So, he will say, Jack and Jill went up. Agar aapne slowly kiya, to stuttering is impossible. And slowly you speed up the thing and you'll find that it becomes easier. Now, this is very simplistic. Very often you have to do many other things. कभी-कभी दवाई देने की जरूरत पड़ती है क्योंकि उसकी वजह से आपको, अगर आपको बहुत ज्यादा घबराहट हो तो घबराहट की वजह से भी हो सकता है. So proper evaluation is necessary.
Great. So, sir, I mean, really, a very.
Hello, Archana, may I ask one question, please?
Yes, please.
Yes,
thank you very much, Dr. Kasi. It's a great session we heard for last 1.5 hours, and really it is helpful to every child and every parent and every teacher. One question I would like to ask, we know that not only parents, but our community and schools also influence the life of child. So while developing child's personality, how to tackle with this to avoid all other negative influences on our child?
Yeah, so one of the things that I always tell parents and I always tell teachers is that somehow the most important part of a child's development happens at home. तो अगर आप घर पे, if you can infuse that feeling of confidence, that feeling के मैं, that feeling के तू जो भी कर रहा है अच्छा कर रहा है, very proud of you, I'm very happy about what you're doing. Of course, if you got 100 marks, I'd be very happy. But if you get 0, I'm not going to be unhappy. I mean, I'm not going to hate you. You're still my child and I still love you. अगर उसको ये लगे कि जो भी होता है घर पे मुझे बहुत सपोर्ट मिल रहा है, बाहर का तो हम कंट्रोल नहीं कर पाते हैं. If the man or the girl can be made to feel that he or she is a lovely person, and just because somebody says you're a horrible person, which sometimes in the community happens, it doesn't mean that you're a horrible person. अगर मैंने आपको बोला तो आप बुद्धू हो, doesn't mean you become a buddhu. That is probably the cause of a lot of underconfidence that we see in our kids, a lot of feelings that I'm not good enough, etc., etc. वो उसने ऐसा क्या बोला ना ऐसे, but who is he to you? कोई नहीं है, लेकिन उसने बोल दिया. But who is he to you? There's nobody. So pay more attention to the people who are important to you, and have the basic trust and faith to realize that I might have a different point of view that doesn't necessarily make me wrong, and that things ease off over a period of time. I mean, all three of us on the screen right now are doctors, and we know that there are so many of us who are doing very well, but so many of us who are not doing very well. So just because you got into a profession and just because you managed to study and become a doctor or become an engineer or become this or that, doesn't necessarily mean you're going to become a successful person.
Absolutely.
And the best doctor may also be underconfident, may also not have the feeling that I can do a lot of things. And the most underpaid, under-evaluated person, even on the streets, can still walk like he owns the world, and very often will own the world as time goes on. So that doesn't mean we shouldn't study, and that doesn't mean we shouldn't do well, but that does mean that there are lots and lots of other factors that make us successful human beings.
Absolutely. So very well said, sir. And with this, we come to an end of today's session. जो लोगों ने अभी बहुत सारे suggestions दिए हुए हैं parenting और different issues related to child health, हम हर 15 दिन में generally we take sessions on the team talk. Zoom पे भी रहते हैं और हमारी जो YouTube चैनल है उस पे भी लाइव आते हैं. So by chance आपको अगर Zoom की लिंक नहीं मिली तो आप वो सेशन डायरेक्टली YouTube पे देख सकते हैं, और अगर नहीं भी देख पाए तो वो रिकॉर्डिंग्स यूट्यूब चैनल पे रहेंगे. यूट्यूब चैनल का नाम है टीन टॉक फॉर बेटर टुमारो. सो आप वो सेशंस बाद में भी देख सकते हैं. आज भी जो सेशन हुआ है उसका पूरा रिकॉर्डिंग अवेलेबल है वो चैनल के ऊपर और वो वहीं रहेगा. सो जिन्होंने ये सेशन मिस किया है, प्लीज गो बैक, tell your friends, tell other parents, tell other teachers to please go and have a look at today's session, because it has been so wonderful and sir has made it so simplified and he has explained it in such a beautiful language that I think it will be very easy for all lay people to understand, and in no uncertain terms he has made it so very clear that a basic understanding of mental health issues in children is very, very, very important, very imperative. The world is changing. The stresses that children are facing is changing, and so it is very important that we as parents make ourselves of the situation, because it is not going to be possible for the children to evaluate themselves by themselves. So it is us as parents and teachers who are going to have to know more and do more to bring out these issues in open and do something about it. So please be vigilant, be safe yourselves, and see to it that our children remain safe, because they are our tomorrow. And so going towards better tomorrow, we need to take better care of our children. So with this, Chowda sir, really sincere thanks from the bottom of my heart. You have really taken a wonderful, wonderful and amazing session. And with this, I really feel happy to present this e-certificate of gratitude for taking this session, for giving your expert advice and guidance on the subject of mental health awareness in this session of Mind Matters Most to students, parents, and teachers during today's Teen Talk session organized by MPHIM Maharashtra State on Sunday, 9th October 2022. And thank you so much, sir. And we are going to take your help for many, many more sessions in the future. And I really hope you take many more sessions for us in the future.
It will be an absolute pleasure. Thank you. Stay safe and happy Diwali.
Absolutely. Thank you so much.